What's up? What's up, everybody? Welcome. We are going to be doing NCLEX questions today. You got to give me a minute. I got to get set up. I was doing stuff. But hey, welcome, welcome, welcome. You guys already know what the deal is. You guys already know what we're about to do. We're about to do NCLEX questions. But of course, I want to know who you are, where you're from, where you're at in your nursing journey. Give me a sec. Your boy's trying to get set up over here. Once we get set up, we will kick off the questions. You guys already know what the deal is. Hey, I need 100 folks up in here. I need 1,000 likes. Y'all, we ain't playing no games today. You know what I'm saying? Hopefully everybody had a good last couple of days. If you guys haven't seen that, I posted one of my students or mentees. She passed her NCLEX on the 21st or the 23rd of December. Took it on the 12th attempt and she rocked it. So shout out to Stacy. If you guys haven't seen that video, guys go over there and check that link out in my bio. Also, you guys can check it out on my YouTube as well. The YouTube one, I actually put more things that are in there. So what's up, Ashley? Happy New Year to you. Samantha, congratulations to me or her. I'm pretty sure you mean to her. So I'm pretty sure she would greatly, greatly appreciate that. All right, y'all, give me a second because I got to get some stuff set up. All right, I think I'm good. I think we're good. All right. Like I said, I want to know who you are, where you're from, where you're at in your nursing journey. Also, I got these questions off nurseslabs.com. Nurseslabs.com, free sets of questions. Make sure you guys can go over there and check that out for yourself. Bella, why are you screaming my name like that? I mean, anyways, ma'am, well, how can I help you? Why are you screaming my name like that? All right, we already got 1,000 likes. That's why I appreciate y'all. Hey, so what's the deal? So we need 100 people up in here. Samantha from Georgia, paramedic student. Shout out to you, Samantha. Samantha, did you come from Kate's page? Did you come from Kate's page? Because, you know, Kate's one of the homies. So, all right, y'all, here we go. I'll give it a couple of more minutes and let some people trickle in here. Like I said, I want to know who you are, where you're from, where you're at in your nursing journey. It says, Kev, have you had to take the TEAS test? Sunshine, I have never had to take the TEAS test. I studied for it when I was trying to get into nursing school, but I didn't need to take it. You came from Kate's page. Shout out to Belle. I know you came from Kate's page because you stay over here. What else are we thinking? Hey, a little bit about me. I've been a nurse for 3.5 years. I've worked ICU, OR, and PACU. I've been in the Navy for 16 years, 4 months, but who's counting? And so, hey, here we are. Teach me nursing stuff. I'm about to. Bree, what's up? How are you? Hey, we're trying to get 100 folks up in here. So I'll probably give it another few minutes. But like I said, I want to know who you are, where you're from, where you're at in your nursing journey. Brittany says, I took the NCLEX today. The weight is driving me insane. Hey, your answers are already set in stone. You know what I'm saying? Your answers are already set in stone. So, you know, there's ain't no need to be nervous about it. It's coming. That your time is coming. All right. Here we go, y'all. Here we go. Give me a sec. Let me set this up. Get my life right. All right, y'all. Y'all know what we're doing. We're doing NCLEX questions. Sorry if that's a little too bright. That's just the way that things just work out here. All right. We're about to get this thing popping. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. If I don't have 10,000 likes by the time we get to 10 questions, I'm boycotting the questions. Try me if you want to. Here we go. I didn't miss it. No, we just started. Here we go. Question number 1. A pediatric nurse is performing a routine assessment on a 1-month-old infant during a well baby visit in the primary care clinic. The infant's mother reports no concerns and states that the baby has been feeding well and has had regular bowel movements. Upon assessment, which of the following finding warrants further investigation by the nurse? This is a select all that apply. So what did I see that is incorrect that requires me to intervene to figure out what's going on? Is it abdominal respiration, irregular heart rate or breathing rate? Inspiratory grunts, increased heart rate when crying, nasal flare, cyanosis, or asymmetric chest movement? What are we thinking? Shout out to everybody in here rocking with me. Hey, smash that like button. Make sure you guys share. Make sure you guys follow. We're doing NCLEX questions. I got them off nurseslabs.com. Free sets of questions. You guys can go over there and check them out for yourself. Like I said, these are all for RNs and LPNs as well. Appreciate the follows. I'll give you guys 15 more seconds. GCEFG. Okay. Or BC. Okay. Definitely F. Well, it's select all that apply. So if it's definitely F, you got to give me some more. Remember, with select all that apply, it's either a few of them, or rarely all of them, or rarely just one of them. Okay. And remember, if you cannot 100% without a shadow of a doubt tell me which one is correct, don't pick it. So if you don't know, don't pick it. Okay. Here we go, y'all. Here's our answer. In 3, 2, and the answer is C, E, F, and G. So for option C, grunting occurs when an infant attempts to maintain an adequate functional residual capacity in the face of poorly compliant lungs by partial glottic closure. As the infant prolongs the expiratory phase against their partial closed glottis, there is a prolonged and increased residual volume that maintains the airway open and also an audible expiratory sound. And for E, nasal flaring occurs when the nostrils widen while breathing and is a sign of trouble breathing or respiratory distress. For F, cyanosis refers to the bluish coloration of the skin and indicates a decrease in oxygen attached to red blood cells in the bloodstream. And for G, asymmetric chest movement occurs when the abdominal or the abnormal side of the lungs expand less and lag behind the normal side. This indicates respiratory distress. Part of health promotions and maintenance. All right. So the answers are C, E, F, and G. Shout out to everybody that got that one right. Here we go. Question number 2. What's up, Kate? Kate, you already know what the deal is. People over here being selfish and don't want to give me likes. So you better get on them. Here we go. Question number 2. During her shift in the maternity ward, Nurse Jackson, cares for Miss Green, who is at 42 weeks of gestation and shows no signs of labor. Given that the fetus is now considered post-mature, Nurse Jackson recalls the risks associated with post-maturity. Among the following potential complications, which one is primarily linked to the post-mature status of the fetus? Is it excessive fetal weight gain, low blood sugar levels, depletion of subcutaneous fat, or progressive placental insufficiency? What are we thinking? Shout out to everybody that's here. We're doing NCLEX questions. I am your gracious host, Kevin. If you guys don't know this about me, I am a nurse. I've been a nurse for 3.5 years. I've worked OR, PACU, and ICU. Also, I failed my NCLEX 3 times. Yeah, I said it. I failed it 3 times. And guess what? No one cares. I don't care about what you think about that. No, none whatsoever. You want to know why? Because no job is going to care how many times you've taken this exam. The whole point is for you to get out here and to improve upon yourself and to do better. All right. So shout out to everybody that's a part of that. Shout out to everybody that's out there doing great things. OK, so taking my NCLEX in 3 weeks, I'm freaking out. That's OK. You can freak out about it. But guess what? You're going to do it scared. Right. All right. 10 seconds, y'all. 10 seconds. I love how you tell me how many times you failed. Gives us hope for our future. Look, I don't got no problem telling y'all that I failed, but apparently other people out here that think they're better than you will tell you that you're a failure for failing, and to keep attempting, you have a problem. Those people can go kick rocks. But here we go. Here's our answer in 3, 2, and the answer is D. It's progressive placental insufficiency. Post-mature or post-term pregnancy is prolonged and exceeds the limit of 38 to 42 weeks. Infants of such gestation are considered post-mature or dysmature if there is evidence that placental insufficiency has occurred and interferes with fetal growth. That is part of health promotions and maintenance. Small section on the NCLEX. Maya said, let's go. That's what I'm talking about. Health promotions and maintenance, smaller section on the NCLEX, about 6 to 12%, if I can recall that right. Still a smaller section, but still very important because it's one of the 8 sections on the NCLEX test plan, okay? Here we go. Zach says he's taking it on Saturday. That's what I'm talking about. Go get it, Zach. Here we go. Question number 3. In the post-surgical unit, now paint the picture, like where are we? The nurse is attending to a client who had a total hip replacement 7 days ago. Okay, so 7 days ago, they had a hip replacement. This client has a history of hypertension, mild asthma, and is on anticoagulant therapy. The client provides feedback about their current situation. Which of the following statements by the client is most concerning, and necessitates the nurse's immediate intervention? Okay, so what is something that, hey, you're going to die if I don't take care of it, or if this is an issue, we need to take care of it right now? So is it A, I have bad muscle spasms in my lower back of the affected extremity. I just can't catch my breath over the past few minutes, and I think I am in grave danger. I have to use the bedpan to pass my water at least every 1 to 2 hours. It's tiring, and it seems that the pain medication is not working as well today. I'm scared. What are we thinking? Remember Maslow's, ladies and gentlemen. There we go. Remember Maslow's, right? So what, physical versus psychosocial, like what comes first? All right. What are we thinking? I'll give you guys 15 more seconds. If you guys are just now joining, welcome. We're doing NCLEX questions. This is for both RNs and LPNs alike. RNs and LPNs alike. I got them off nurseslabs.com. Free sets of questions. You got to go over there, check that out for yourself. Make sure you guys smash that like button. Make sure you guys share and make sure you guys follow. Hey, we're on the road to 10,000 likes. Grace says impending doom. That's what I'm talking about. That's what it sounds like to me, right? All right. Hey, 10,000 likes by the time I get to question 10, or I'm boycotting the rest of these questions. Ask people and don't think I won't. Here we go. Here's our answer in 3, 2. And the answer, of course, is B. I just can't catch my breath over the past few minutes, and I think I'm in grave danger. That is most definitely a sense of impending doom, just like Grace said. The nurse would be concerned about all of these comments. However, the most life-threatening is B, right? Because that's an airway issue. Clients who have had hip or knee surgery are at high risk for developing postoperative pulmonary embolism, right? Embolism. Somebody else said that as well. That's part of reduction of risk potential, which is 9 to 15% on the NCLEX exam. What's up, Alyssa? How are you? All right. Hey, make sure when you guys are studying, you need content, you need Q&A, you need rationale. All right. Stop playing with me. Stop playing games. Stop playing with yourself. Pause. You guys already know what the deal is. Here we go. All right. I don't think you have to be in nursing to know that. Andy, you'd be very surprised because there's a lot of people that aren't in nursing, which is a lot of people, and they don't know that. So you can't say, hey, I have a sense of impending doom. If I said that, you're going to be like, oh, okay. But if somebody's telling me I can't catch my breath, I don't know why they can't catch their breath. But hey, you'd be very surprised. But that's what education is for. You know, like when you do preoperative and postoperative education, that's what it's for, to keep everybody involved. Here we go. Question number 4. In the cardiology unit, a nurse closely monitors a 33-year-old male client diagnosed with heart failure. The client, a previously active triathlete, was recently started on furosemide due to increased fluid retention. The client mentions a few changes he noticed over the past week, which the following statements by the client would suggest he may be experiencing a negative side effect from the furosemide. Is it A, I was surprised to see my weight jump up by 5 pounds in just a few days? Is it B, I've noticed some swelling around my ankles by the end of the day? Is it C, my stomach has been feeling upset lately, especially after I take the pill? Or is it D, I haven't been as hungry this past week, even for my favorite foods? What are we thinking? What are we thinking? Hey, make sure you guys smash that like button. Make sure you guys share and make sure you guys follow. So here's a question for you. When somebody has heart failure, what are the common signs of symptoms of somebody who has heart failure? Why would I prescribe them furosemide? What is that going to do for somebody who has heart failure? And then once I give them that medication, what is the expected outcome? Edema, fluid retention. There we go. Edema, fluid retention. Okay. Yeah. All right. That's a shortness of breath. Yeah. There you go. I'll give y'all 10 more seconds. Appreciate all the likes. Appreciate all the follows. Decrease swelling. Alexa said, I want to decrease swelling. Right. But what else does furosemide do? If I get rid of all of these fluids, what else? What could also happen if I push out too many fluids? Heart failure results in edema, so the diuretic will help drain the fluid. Yep, sure will. Dehydration, right? What's an electrolyte imbalance I could have? Right? Think about that. There we go. Low potassium. Y'all are some smarty pantses out here. That's what I'm talking about. But here's your answer. Your answer is D. Your answer is D. I haven't been as hungry this past week, even for my favorite foods. Now let's look at it. All right. There we go. Somebody's like, whoa, let's hear it out. This is why it's important that we read our rationales, right? Furosemide is a loop diuretic that is used for pulmonary edema in heart failure, nephrotic syndrome, and hypertension. Furosemide causes potassium loss unless a supplement or a potassium-rich diet is taken. A decrease in appetite is caused by hypokalemia. Signs and symptoms of hypokalemia include anorexia, fatigue, nausea, decreased GI motility, muscle weakness, dysrhythmias, reduced urinary osmolality, and an altered level of consciousness. That's part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX at 14 to 18%. All right. That's what I'm saying. This is why kids stay in school. Hey, who said that? Is it Denko? Hey, so sometimes some of these things you're not necessarily going to remember, but on the bright side is like you need to be able to understand. Like we can get into the weeds, that's totally different. But hey, That's something, hey, this is why it's so important that you read your rationales. This is how you prepare. The largest section on NCLEX is management of care. It's 18 to 23%. So assignment, delegation, supervision, so on and so forth. Here we go. Question number 5. A 32-year-old pregnant woman comes to the clinic for her prenatal visit. The nurse gathers data about her obstetric history, which includes 3-year-old twins at home and a miscarriage 10 years ago at 10 weeks gestation. How would the nurse accurately document this information? Fill in the blanks. All right. So what are we thinking? Maya saying, all of my ladies that are in here that have had kids, I would expect all of you guys to get this answer right. I would expect you all to get the answer right. I'm not even gonna lie to you. Maternity, labor and delivery, mother, baby. That was one of the hardest sections for me to learn because obviously, I am a male and I don't push babies out. What are we thinking? We got 4-2, 3-2, 3-2. Shout out to everybody that's in here rocking with me. We are on the road to 20,000 likes. So shout out to y'all. Hey, get carpal tunnel for me right now. Do it. Do it. Do it. There we go. Hey, and also, if you guys don't understand what information that we're reading, it ain't nothing that a quick Google search won't tell you. Got pregnant 3 times. All right, y'all, 10 more seconds. 3-2, 4-2, 2-1. Okay. G is the amount of pregnancy. P is live birth. Shout out to you, Kate. Kate's Miss Smarty Pants over there. Anybody that's a paramedic or anything like that? Hey, Kate is your gal. She is your gal. All right, here we go. Here's our answer in 3, 2. And the answer is G3. P1, all right, or gravida 3 or gravida 3 and para 1. Gravida is the number of confirmed pregnancies, and each pregnancy is only counted one time, even if the pregnancy with multiple gestation, so twins or triplets. Somebody else said that down there. Somebody said no. Yes. Para indicates the total number of pregnancies that have reached viability, which is 20 weeks, regardless of whether the infants were born alive. Thus, for this woman, she is now pregnant. She's had 3 prior pregnancies and 1 viable birth, which was twins. Okay. So there we go. Okay. Taking notes. That's what I'm talking about. Shout out to you, Des. I see you out there. I appreciate everybody here rocking with me. Hey, 20,000 likes. Let's get there. Hey, ladies and gentlemen, I have a free download over on that website right there that you guys see on the screen. Also, that link is in my bio. Test taking tips to conquer the NCLEX. Hey, check out my fanny pack though. All right, stop playing games. Everybody go get you a fanny pack. You know what I'm saying? Free download over there, 42 pages. You guys go over there, check that out for yourself. Hey, and with that, we are rocking. Appreciate all the follows. Here we go. Question number 6. In a wound care clinic, Nurse Palmer is assigned to Miss Harris, a 27-year-old female with a history of deep vein thrombosis. Miss Harris presents with a venous stasis ulcer on her left leg, which has persisted for the last 3 months despite home care efforts. Miss Harris has been managing the ulcer with over-the-counter dressings and is concerned about the lack of progress. She has also mentioned that she's been feeling fatigued lately and is unintentionally lost 5 kilos over the past month. Based on the assessment and the client's history, which nursing intervention would be most effective in promoting the healing of the ulcer? Is it applying dressings using sterile technique, improve the client's nutritional status, initiate limb compression therapy, or begin the prolytic debridement? What are we thinking? What are we thinking? Shout out to everybody that's in here rocking with me. We are on question number 6, doing NCLEX questions from nurseslabs.com. Free sets of questions. You guys go over there and check those out for yourself. And also smash that like button. Smash that like button. Make sure you guys share. Make sure you guys follow. That is the trifecta that TikTok needs and that I want so I can get out there to people. Okay. Give y'all 15 more seconds. I got a bunch of people saying B. Got some people saying A. Hey, I had an energy drink, so if I'm talking too much, I don't care because I talk too much anyway. So I love y'all. Appreciate y'all being here. Also, if you're new here, I want to know who you are, where you're from, and where you are at in your nursing journey. And if you are not a nurse, what are you doing here rocking with us? And the answer is B, improve the client's nutrition status. Venous stasis occurs when venous blood collects and stagnates in the lower leg due to incompetent venous valves. All right. So that is part of basic care and comfort. Smaller section on the NCLEX, but still very much important at 6 to 12% because it is part of the NCLEX test plan that they released which has always been part of the NCLEX test plan. But the NCLEX test plan was actually updated April 1st of 2023. So it ain't even been a whole year yet. But basic care and comfort, something that you learn in foundations or in fundamentals or whatever, you know, that's all part of that. All right. Now, real quick, this one right here is one that we're going to put in order. So I'm telling you right now, a nurse is to administer Demerol 100 milligrams, atropine 0.4 milligrams, and Phenergan at 50 milligrams IM to a preoperative client. List the order in which the nurse must carry out the following actions prior to the administration of the preoperative medications. Instruct the client to remain in bed, raise the side rails on the bed, have the client empty their bladder and place the call bell within reach. What are we thinking? Adrian says 3214. Shout out to NY. I see you out there. LaShonda. Hey, LaShonda from Alabama. Why are we giving all three at the same time? What are you talking about? Oh, you're talking about the medications based off of whatever is ordered. Right? And here's the thing. What does atropine do? What does Demerol do? What does Phenergan do? Think about it. Think about it. Lexington, Kentucky. I see you out there. 3214, 3124. Okay. Makes you sleepy. It does make you sleepy. All right, y'all. I'm going to give y'all 10 more seconds. Shout out to all 500 plus of you guys in here rocking with me. Make sure you guys like. Make sure you guys share. Make sure you guys follow. Like, share, follow. Hey, 20,000 likes. That's where we're going. That's where we're on the road to. Here we go. And our answer in 3, 2. And the answers are below. It is going to be have the client empty their bladder first. The first step in the process is to have the client void prior to administering the preoperative medications. Then you want to instruct the client to remain in bed. Preoperative medications can cause drowsiness and lightheadedness. Somebody said that as well. The third one is I want to raise the side rails because raising the side rails of the beds helps prevent accidental falls and injury. And then, of course, last thing you want to do is you want to have that call bell within reach in case of something happening. All right, that's part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX at 14 to 18%. Kiki says, yes, that's what I'm talking about. So shout out to all y'all who got that right. All right, here we go. Question number 8. Nurse Jackson has recently taken on the role of nurse manager for a busy medical surgical unit. She wants to implement an effective reward feedback system to improve team performance and foster professional growth. During a team meeting, she discussed potential strategies for feedback. Which of these statements a team member makes best describes the characteristics of an effective reward feedback system? We should provide specific feedback immediately after a task is complete or observed. Everyone should get feedback, both good and bad, in equal amounts regardless of individual performance. Always begin with a compliment before providing any constructive criticism. We should set performance expectations so high that only a few can reach them. Well, let me tell you something right now about letter D. What are we thinking? Shout out to all 400 plus of y'all. We're doing NCLEX questions. Got them off nurseslabs.com. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. Hey, get carpal tunnel for me right now. Make it happen. Also, if you're new here, another known little fact about me. I've been in the Navy for 16 years. 16 years, 4 months. Who's been counting? You know what I'm saying? So I was actually an instructor in the Navy, a surge tech, and hospital corpsman. So have a pretty good background of education. I've been teaching. It'll be 9 years next week that I've been teaching. So shout out to all y'all for being here, rocking with me. All right, here we go. Here's our answer in 3, 2. Is it just me or is the question cut off on the left? It might be cut off for you, so I could back it up just a smidge. See if that works. It's cut off. Okay. I'm glad somebody told me because nobody's been telling me and I've been on these questions. It's cut off for me too. Oh, it's great now. Cool. Got you. So the answer is A. We should provide specific feedback immediately after a task is complete or observed. Feedback is most useful when given immediately. Positive behavior is strengthened through immediate feedback and is easier to modify problem behaviors if the standards are clearly understood. That is part of health promotions and maintenance. Smaller section on the NCLEX, 6 to 12%. All right. Appreciate y'all. Perfect. See, y'all got to tell me, hey, Kevin, it's kind of cut off on the side. You know, can you help me out? I got you. I'm not mean all the time, y'all, or temperamental or whatever. Here we go. Question number 9. Nurse Martinez is caring for Mr. Reyes, a 45-year-old client newly diagnosed with multiple sclerosis. Now paint the picture. What is MS, right? Mr. Reyes is an active individual and has voiced concerns about how this diagnosis will affect his fitness regimen. During a teaching session about safety exercises and physical activities for MS patients, Nurse Martinez provides various recommendations. She later evaluates Mr. Reyes's understanding of the information provided. The nurse determines the client needs additional teaching if Mr. Reyes makes which of the following statements. Select all that apply. Select all that apply. This is where you hear me tell you the RTFQ. Who can tell me what RTFQ means? Because some of y'all only put like one answers, right? You put one answer, guess what? That means you could possibly get the question wrong. So RTFQ. Yeah. Oh, I didn't even RTFQ. Look at you, Alyssa. You know better. You know better. There you go. Ashley says, read the question. Ashley, where's my F at? What does the F stand for? It's okay, Ashley. You can say it. You can say it. Is this a nursing class? Yes. Read the full question. Really, Sunshine? You know what? Fine. That's fine. That's fine. That works. All right. Shout out to all y'all. We're doing NCLEX questions. This is both for nurses, RNs, and LPNs. Okay. Got them off nurseslabs.com. It's the F word. It could be the F word. Somebody told me full. So, whatever. I'll give y'all 10 more seconds. Make sure you guys like, share, follow on the road to 20,000 likes. Here we go. And here's our answer in 3, 2, and thank you for the follow. And the answer are B and E. Patients with multiple sclerosis should not exercise to the point of fatigue, as strenuous physical exercise raises blood temperature and may agitate symptoms. It's essential to exercise, but not to the point of exhaustion. And also option E, continuous exercise with no rest period is contraindicated for patients with MS who want to exercise. The patient should be advised to take short rest periods, preferably lying down. Again, extreme fatigue may contribute to the exacerbation of symptoms. That's part of health promotions and maintenance. Shout out to everybody for all the likes and all the follows. We're going to 20,000 likes. I appreciate you. On to the next one. Here we go. Question number 10. Look, y'all got me to 16,000 likes, and that's what I'm talking about. Nurse Anderson is visiting the home of Mrs. Thompson, an 80-year-old woman with advanced Alzheimer's disease. Mrs. Thompson's family, including her daughter and son-in-law, have been primary caregivers and made several modifications to accommodate her needs. Nurse Anderson, assessing the quality of home care provided to Mrs. Thompson, seeks to prioritize the safety and well-being of the patient. During her evaluation, which statement made by the daughter will the nurse reinforce as being the utmost important? So what is the most important statement that the daughter had said? So what are we thinking? Shout out to all 400 plus of y'all. Like I said, we are doing NCLEX questions for both RNs and LPNs that are going up to take that exam. Got them off nurseslabs.com. Free sets of questions. You guys can go over there and check those out for yourself. But what I need is for y'all to smash that like button. I need for y'all to share. And I need for y'all to follow. That's what I need. That's what I need. Also, if you are new here and I've never seen you before, I want to know who you are, where you're from, or where you're at in your nursing journey. It's still cut off? It ain't nothing to cut that question off. All right, here we go. Let's see. That might work. Hey, I can only do it so much. If I bring it back too far, you may not be able to read it. What's up, Gabby? How are you? Here we go. LPN soon to be wound care nurse. That's what I'm talking about. Manifest it. Here we go. Here's our answer, y'all. Here is our answer in 3, 2. Shout out to Ghana. Yeah, I see you're back, Gabby. I see you out there. And the answer is C. We have safety bars installed in the bathroom and have 24-hour alarms on the doors. Note, all options are correct statements. However, safety is most important to reinforce as part of safety and infection control. Ensuring the safety of the client with increased memory loss is a priority of home care, right? That is what the most important aspect. Dang it, safety first. There you go, April. It's blurry. All right, let's see what I told you. If I bring it back too far, it's going to get like that. There's only so much I can do. All right, I'm going to on to the next question. Let's see if that works. All right, real quick, ladies and gentlemen, I have an ebook. I call it the NCLEX Victory Guide. You want to know why? Because in order for you to conquer, it starts with you. And by the time you conquer your NCLEX, that's a victory because it starts from from the moment you opened your mouth to the moment you get a license. All right, check that out. thebootnurse.com/victory. You guys can check that link out in my bio as well. Hey, there's over 700 pages of all types of important information over there. You guys can go check that out. That link is in my bio. All right, here we go. Question number 11. It's just the answers, things because it's highlight. Yeah, it might just be that. There's some of them that I did that with, but it's not really showing up well, so I probably won't do that for future questions. Here we go. Question number 11. A nurse is reviewing a patient's medication during shift change. Which of the following medications would be contraindicated if the patient were pregnant? Select all that apply. So which one of these medications can I not give to a pregnant person? Okay. Sometimes you have to reword it, not change it up completely, but you have to reword it in order for you to understand. Okay. Shout out to all 360 you guys in here rocking with me. All right. On the road to 20,000 likes, 20,000 likes. Appreciate y'all. Warfarin is a blood thinner. Who the hell is calling me right now? All right. What we got? ACE, ABD. Okay. B for sure. Okay. B for sure. I'll give you guys 10 more seconds. A&E, ACE, Bless and Alana, thank you for the follow. Appreciate you. Is it Hadassah? Thank you for the follow. Appreciate you. Danny Wolf, appreciate the follow as well. Here we go, y'all. Here's our answer in 3, 2. And the answer is, yeah, that's really bright. That's my bad. Let me see something. I'm just going to take that off. But yeah, so our answers are A and B. There we go. There, that's better. So yeah, so the answer is warfarin and was it fena or propsia. Oh my god, propsia. There we go. So yeah, so it's warfarin. Has a pregnancy category X and associated with central nervous system depression, spontaneous abortion, stillborn, prematurity, hemorrhage, and ocular defects. And Prospia also has a pregnancy category X, which has a high risk of causing permanent damage to the fetus. All right. Maternity, my least fave. Trust and believe me, maternity is my least fave as well. Also, that's part of pharmacological and parenteral therapies. All right. Which is the second largest section on the NCLEX exam. Second largest section on the NCLEX exam at 14 to 18%. You got to know your pharmacology. And they can throw in pharmacology anywhere, in the respiratory section, neuro, anywhere. Got to be ready for it, okay? Here we go. Question number 12. A nurse is reviewing a patient's past medical history. The history indicates that the patient had a photosensitivity reaction to medication. Which of the following drugs is associated with photosensitive reaction? Select all that apply. Why is that not in the maternity? So here's the thing. They can actually put it in the maternity section. So the client needs section would be pharmacology, but the subcategory would be maternity, if that makes sense, Alyssa. You start pharma on Friday. Hey, you about to be ready for it. You about to be ready for it. All right, we got A, B, D, E, A, C, E, E. That makes sense. Yeah, that makes sense. AC. How do I sign up for you for tutoring? Is it Sonu? You can go check the link out in my bio. And there's 2 categories. One is like private one-on-one, which is like get you like one session. And then it's like, it's one session. And then the other one is the NCLEX coaching, which is a package type of thing. All right, here we go, y'all. Here's our answer. Here is our answer coming to you in 3, 2. And that is hella bright. So let us hella bright this. But the answers are... A, B. Let's see how we do that. A, B, C, D, and E. Photosensitivity, right? Photosensitivity is an extreme sensitivity to UV rays from the sun and other light sources. Ciprofloxacin is used to treat a variety of bacterial infections and belongs to a class of drugs called the quinolone antibiotics. This antibiotic treats only bacterial infections. Right. So there we go. And that is part of course, pharmacological and parenteral therapies. This is a lot, so I'm not going to read it, and it's kind of small because, yeah, there you go. Common UTI meds. Yep, there you go. And also remember, when you guys are studying, you need Q&A, you need content, and you need your rationales. Content, Q&A, rationales. And this is the point where if you got it wrong, you need to understand why you got it wrong. Okay, so shout out to everybody. Farm school. Hey, if you're a pharmacist or going to be a pharmacologist, hey, it's right up your alley. Question number 13. A 68-year-old female patient recently diagnosed with Parkinson's disease and rheumatoid arthritis tells you during a follow-up visit that her urine is starting to look discolored. She also mentioned that she has been taking over-the-counter medications for constipation and occasional headaches. Given her medical history and the potential side effects of medication, which of the following of the patient's medications is least likely to cause urine discoloration? All right, so which one? Is it sulfasalazine? Is it levodopa? Is it the phenolphthalein? Or is it aspirin or acetylsalicylic acid? Try saying that one. Try saying that one like 5 times fast. Shout out to all 300 plus y'all in here rocking with me. We're on the road to 20,000 likes. Make sure you guys keep smashing that like button. Make sure you guys share. Make sure you guys follow. That's the trifecta. Also, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Also, if you're not a nurse, what are you doing here rocking with us? What are we doing here? Hey, the more that you guys share, the more that you guys follow, the more it brings people up in here. All right. Always trying to shoot, for having a lot of people in here. How long you're here? I'm guessing you're asking me how long am I here and until I finish the questions. And also, I'll do an Ask Me Anything after this as well. So anybody has questions about nursing and stuff like that, I'll try to, give them the best aspect that I can give them. But here's our answer, y'all. Here's our answer in 3, 2, RN loading. That's what I'm talking about. And the answer, of course, is aspirin. Aspirin is not known to cause discoloration, right? Aspirin is not known to cause discoloration of the urine. Side effects and complications of taking aspirin include stroke, caused by a burst blood vessel. Of course, this is part of pharmacological and parenteral therapies, which is what? It's the second largest section on the NCLEX exam. The second largest section on the NCLEX exam at 14 to 18%, give or take. All right, FSEJ, shout out to Florida. You must be in Jacksonville because I've been there. I took a lot of my prereqs there, so, shout out to you. But yeah, so here we go. There it is, pharmacological parenteral therapies. All right, so shout out to everybody that got that right. Here we go. Question number 14. Hold on one second. Your boy got to put the charger on us. Got to put the phone on the charger. Here we go. You are a charge nurse responsible for reviewing the nursing unit refrigerator at a busy urban hospital that has recently experienced a power outage. The outage lasted for a short period, but you are ensuring that all medications are stored correctly post-outage. During your review, you find several medications, some of which are critical for patients with chronic conditions. Which of the following drugs, if found inside the fridge, should be removed and replaced due to incorrect storage? What are we thinking? You're welcome. You're welcome. You're welcome. What are we thinking? This is not a select all that apply, by the way. This is not a select all apply. So there's one. There can only be one. There can only be one. This is where I tell you to RTFQ, read the question, because a bunch of y'all would have tried to pick multiple answers, right? So what are we thinking it is? What are we thinking? Which of the following drugs? What are we thinking? Shout out to everybody that's in here rocking with me. We're doing NCLEX questions. Got them off nurseslabs.com. Got me to 20,000 likes, so I appreciate y'all. Hey, but keep smashing that like button. Hey, I'm trying to get at least 100 shares. Need 100 shares out there, so I don't care. Hey, if you're in school right now, there should be no reason why you shouldn't share this with your cohort. All right, here we go. Here we go, y'all. Here's our answer. Here's our answer in 3, 2, and oops, just kidding. There we go. And so the answer is A. It's Corgarg or Nadolol or Nadolol. There we go, Nadolol. Nadolol is a beta blocker used to treat high blood pressure and angina. It does not require refrigeration and should be stored at room temperature, away from heat, moisture, and light. The other medication listed have specific storage requirements that may include refrigeration, especially once open or in use. All right, that is part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX, ladies and gentlemen. Second largest section on the NCLEX, ladies and gentlemen. I sound like Dave Chappelle when I said that. But anyways, so make sure you guys, hey, you need content, you need Q&A, you need rationale. Have all three. I read the question wrong. What's that mean? RTFQ. What does RTFQ mean? I need somebody to let me know down in the bottom. Let me know down in the bottom. Here we go. Question number 15. A 34-year-old client who is a renowned biologist specializing in immunology, has recently been diagnosed with an autoimmune disease. During a consultation, she discussed her concerns with the nurse, mentioning her recent discovery of her pregnancy, or being pregnant, sorry. She expresses her worry about the potential impact of her condition on the fetus and is curious about the body's natural protective mechanism. Given her background and concern, which of the following immunoglobulin should the nurse explain as the only one that will provide protection to the fetus and the womb? Is it IgA, D, E, or G? What are we thinking? A, I think. Okay, Kate, I see you out there. Shout out to all 500 plus of you guys in here rocking with me. We're on the road to 30,000 likes, y'all. Give me the 30,000 likes. Make sure you guys share. Make sure you guys follow. That's the trifecta. I got these questions off nurseslabs.com, which are free sets of questions. You guys can go over there and check those out for yourself. Also, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Don't just come here and take and not give to somebody. You know what I'm saying? Share it with somebody. I make you want to take nursing now. Hey, this may look easy, but let me tell you, it's not. It's not. All right, y'all, here we go. You take your NCLEX. Is it Isabel? You take your NCLEX on Friday. Shout out to you. I know you're going to go out there and you're going to rock it. Here we go. Here's our answer in 3, 2. It says, can you tell us why they add unnecessary stuff in questions, renowned biologists? Because they're distractors, and that's why. It's to make sure that you read the question so you don't get distracted by all these fillers. But the answer is D. It's the immunoglobulin G is the only immunoglobulin that can cross the placental barrier. There it is. All right. Pharmacological and parenteral therapy, second largest section on the NCLEX at 14 to 18%. Hey, remember, management of care, pharmacological and parenteral therapies, and physiological adaptation are the three largest sections on the NCLEX at 44 to 49%. They make up almost half of the entire exam. You know how to conquer those, you will conquer that exam. All right. So, hey, real quick, I have an NCLEX course. You guys can check that out. That link is in my bio. I have 60 videos in there right now to include a new generation NCLEX review where I go over 100 questions and some tips and tricks at the end of that. You guys can go over there and check that out. Hey, once you have it forever. So if you pass away and you want to pass it to your descendants, hey, it's there. I'm just saying, you know, the ancestors willing, as long as they got your email and your password. So make sure you guys go over there and check that out. That link is also in my bio. Say that again. What's the majority of the NCLEX? 44 to 49% management of care, physiological adaptation, and pharmacological and parenteral therapies. Here we go. Question 16, a second-year nursing student who is on a clinical rotation in the infectious disease unit of a major urban hospital has just suffered a needle stick injury. Now paint the picture, all right? The incident occurred while the student was assisting a blood draw for a patient known to have a high viral load and is positive for AIDS. Lord have mercy. The student is visibly shaken, as they should be, as they are aware of the patient's medical history. Given the circumstances and potential risks, which of the following is the most significant action that the nursing student should take immediately following the incident or after the incident, right? So what is the very first thing that you should do? What do? Immediately see a social worker to discuss potential implications. Start prophylactic AZT treatment as soon as possible. Start prophylactics. Potamidine. Yeah, potamidine. Treatment to prevent potential infections, seek counseling to address potential emotional and psychological impact, report the incident to the clinical instructor and fill out an incident report, or seek immediate testing for HIV to establish a baseline. What are we thinking? Shout out to everybody that's in here rocking with me. We are on our road. We are on the road to 30,000 likes. I appreciate it, everybody. Make sure you guys like, make sure you guys share, make sure you guys follow. I got these questions off nurseslabs.com. You guys can go over there and check them out. They're free sets of questions for you and for me and for whoever wants to go over there. And by the way, if you're in nursing school, they have nursing care plans that are over there that are just the bee's knees. I'm telling you right now, I used them the whole time while I was in nursing school. No, it's not cheating. It's just another tool that you can use. So don't let your professors try to scare you and lie to you because they're full of shit. So I'm just letting you know. Kim says, I've been a nurse for 12 years, seeing if you still, hey, if you still got it, Kim, you still got it. Nurseslabs.com. Here we go, y'all. Here's our answer. Here is our answer in 3, 2, and the answer is B. All right, the answer is B. Start prophylactic AZT treatment. All right, is the most critical intervention. It's an antiviral medication used to prevent and treat HIV/AIDS by reducing the replication of the virus. That is part of safety and infection control. All right, post-exposure prophylaxis to HIV is a treatment to suppress the virus and prevent infection after exposure. What is it? The post-exposure prophylactic should be taken within 72 hours of possible exposure to HIV. So it is important to seek treatment immediately. While reporting the incident, seeking counseling and other actions are also important. The immediate priority is to reduce the risk of HIV transmission. All right. I'm just letting y'all know that answer needs revising. Hey, here's the thing is that we may get 3 or 4 of these wrong. Right? We may get 3 or 4 of these wrong. They could be poorly written because trust and believe me, some of these are poorly written. But one thing I will tell you is that if I gave you 100 questions and 5 of them need to be omitted, it doesn't mean for the simple fact that you could actually just fail the exam. Now, in reality, you got to tell somebody. In reality, you got to report first. I'm not saying that y'all are incorrect. I just need for y'all to understand that. You got to be like, oh my God, I got stuck. Help. And then you're gonna start scrubbing fingers, right? You got to start scrubbing your fingers, got to start washing it. Then you got to get down to the freaking ER, get all your labs drawn, get the prophylactics. And then you're going to be with occupational therapy. They're going to be following you forever. Trust and believe me. I understand, right? I understand. But remember, you got to read the question and give the perfect what they want for you to give. Okay, here we go. I can't read your question. That looks like a good question, but I can't read it. Question number 17. A 35-year-old male who is a professional marathon runner has been an insulin-dependent diabetic for 5 years. He visited a clinic expressing concerns about recent changes in his training performance. He mentions fatigue, occasional dizziness, and now an inability to urinate for the past 24 hours. Given his professional medical history and the presented symptoms, which of the following complications of diabetes would you most likely suspect? What do you think it is? Atherosclerosis, diabetic neuropathy, autonomic neuropathy. Diabetic nephropathy, autonomic neuropathy, somatic neuropathy, diabetic, retinopathy or retinopathy, or is it hypoglycemia? What do we think? What do we think it is? Shout out to all 500 you guys in here rocking with me. Hey, I know it takes a minute for me to read these. So I'm trying to read comments and see what y'all are talking about and trying to read this at the same time. So I appreciate everybody being patient. Here we go. Hey, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. That's the trifecta. We got to get it out there to people that need it. I'll give you 10 more seconds. Here we go. Do I think nurse practitioner is worth it? That just depends on if you want to be a nurse practitioner. I don't think nurse practitioner is worth it because I don't want to be one. Here we go. Here's our answer. Here's our answer in 3, 2, and the answer is autonomic neuropathy. Autonomic neuropathy affects the autonomic nerve, which controls the bladder, intestinal tract, and genitals, among other organs. Paralysis of the bladder is a common symptom of this type of neuropathy as manifested by bladder urgency and inability to start urination as part of physiological adaptation, which is the 3rd largest section on the NCLEX at 11 to 17%. 11 to 17%. These are fun. Hey, I'm glad that you're having fun. Shout out to everybody that's, hey, if you're really having fun, get carpal tunnel from me right now. No, I appreciate you. I'm glad that you guys are enjoying this. I don't even know if I learned that. If you didn't learn it, that's cool. Now you can. Now you can learn more about it. All right. Now you can learn more about it. All right, here we go. Question number 18. You are conducting a health assessment in a high school clinic. A 14-year-old girl who is a lead ballet dancer in her school's performing arts program comes in for a routine checkup. She has a BMI of 18 and appears fatigued. During the assessment, she hesitantly discloses her inability to eat, occasionally induced vomiting after meals, and severe constipation. She also mentions increased pressure to maintain a certain physique for her upcoming performance, giving her age, extracurricular activity, and the present symptoms. Which of the following conditions would you most likely suspect? Would it be multiple sclerosis, anorexia, bulimia, systemic sclerosis, gastrointestinal obstruction, or performance anxiety? What are we thinking? Obviously C. You can't say obviously C because there's obviously people in here who don't know that answer. But, you know, shout out to you. But obviously, not everybody's going to know that answer. But shout out to y'all. Appreciate everybody being in here rocking with me. We're doing NCLEX questions. Got them off nurseslabs.com. Free sets of questions. Free sets of questions for y'all. Y'all go over there and check them out. Also, if you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse, what you doing here hanging out with us? All right, I'm going to give y'all 10 more seconds. 18 is the limit. All right. All right, let's see what we got. Here we go. Alicia and Coco, or is Alicia and Coco. Thank you for the follow. Graduate this spring. Shout out to you, Sam. Here we go. Chi-Town senior year. That's what I'm talking about. Here we go. Here's our answer in 3, 2. Vixen says, I'm waiting for that ATT. It'll come. And the answer is B. Anorexia nervosa is an eating disorder characterized by weight loss, difficulty maintaining an appropriate body weight for height, age, and stature, and in many individuals, a distorted body image. This girl's BMI is 18. Inability to eat, induce vomiting, and the context of pressure for her ballet performance strongly suggests anorexia nervosa. While bulimia nervosa also involves episodes of overeating followed by purging, the girl's low BMI and inability to eat align more closely with anorexia nervosa. The other options are less consistent with the present or with the presented symptoms and context. That's part of physiological adaptation. I know a lot of y'all are about to just be like, bro, I'm mad. Why did I get that wrong? Hey, this is why it's important that you understand your content. And it's even more important why you read your rationales to see why the answer is correct. All right. But this is all practice. This is what you're supposed to go through in practice. You practice hard, get it wrong, perfect it, do better. That way, when you go and you take your test, you're going to go out there and you're going to show out. It's going to feel just like practice, especially if you've been practicing to improve. I changed my answer. You should have never did that. I think we've talked about that before. I've talked about that before, too. Here we go. Question number 19. A 24-year-old female who recently returned from a mountaineering expedition is admitted to the ER presenting with confusion. The patient's medical records indicate a history of myeloma diagnosis. She also reports having experienced constipation, intense abdominal pain, and polyuria during her expedition. She mentioned that she had limited access to water and relied heavily on packaged foods during her trip. Giving her recent activity, medical history, and the presenting signs and symptoms, which of the following conditions would you most likely suspect? Most likely suspect, right? Diverticulitis, hypercalcemia, hypocalcemia, irritable bowel syndrome, is it altitude sickness, or dehydration? Somebody's talking about the previous question. We already passed that. I didn't even see. All I saw was bulimia, so I don't know exactly what we were talking about. But shout out to all 400 plus of you guys in here rocking with me. Hey, keep sharing, keep following. Trying to get to 30,000 likes. I appreciate y'all. We're on question number 19. I got these questions off nurseslabs.com. They're free sets of questions. Alicia says dehydration. Okay. All right. Got F. I'll give y'all 10 more seconds. 10 more seconds. Sonu says F. KT says B. Okay. Nikki says E. All right. Yes, Jan. Yes, Jan says C. All right, Megan says F. All right, here we go. Let's see what the answer is. Can you do an NREMT class? I cannot, Jacob, because this isn't for NREMT. If you want NREMT, you want to go to Kate's page and Medicate. Trust and believe me. Here we go. And the answer is B. The answer is B, hypercalcemia. Hypercalcemia is characterized by elevated calcium levels in the blood. Myeloma can lead to bone destruction, which releases calcium into the bloodstream. The symptoms of hypercalcemia include confusion, polyuria, constipation, and abdominal pain, all of which the patient is experiencing, while the other options might be considered given certain aspects of her presentation. The combination of her myeloma diagnosis and the specific symptoms she is exhibiting make hypercalcemia the most likely suspect. This is physiological adaptation, y'all. 11 to 17% on the NCLEX, 11 to 17% on the NCLEX exam. Makes up one of the big three. That's what I call it. This is where it says I take Medicaid Friday. I take the Medicaid Friday. Last time crash. Hey, that's the one, Jacob. That's the girl you want to go to. But hey, physiological adaptation. All right. Remember, you need content, Q&A, and rationales. This is how that's how you understand if the question is correct. That's how you understand if the question is correct. You want to be able to retain your information that way. All right. Here we go. Question number 20. A 28-year-old woman in her second pregnancy visits the prenatal clinic. During her first pregnancy, she does not receive any postnatal RhoGAM shots. Her medical record indicates that she is Rh negative. The father of the child, however, is Rh positive. Given the potential risks associated with Rh incompatibility and the importance of preventative care, under which circumstance would RhoGAM most likely be administered to the mother to prevent hemolytic disease in the infant? What do we think it is? Is it the mother being Rh positive, infant being Rh positive, mother being Rh positive, infant Rh negative? Mother is negative, baby is positive. Mother is negative, baby is negative when the mother and the infant have an unknown Rh status? Or is it when the mother has previously received RhoGAM in a prior pregnancy? What are we thinking? What are we thinking? Got a bunch of people saying C. Shout out to all 500 plus of you guys in here rocking with me. We are doing NCLEX questions for both RNs and LPNs. When it comes to content, LPNs and RNs need to know the same exact thing. RNs and LPNs need to know the same exact thing. LPNs need to know what they can and cannot do and what they can and cannot accept. Right? RNs, we do not delegate what we eat, right? We do not do that. LPNs, we can do sterile activities such as Foley catheters. We can do wound care, right? We can do IM medications, but we can't do IV medications, right? So shout out to y'all. These are the things that you need to understand and what the differences are. All right. Here we go, y'all. Here's our answer. Here's our answer coming in 3, 2, and the answer, sorry if it's highlighted, I'm going to unhighlight, but the answer is C. The answer is C. Let me undo this. Obviously, that was a bad idea for me to do that way. Anyways, but the answer is C, right? So the mother is Rh negative and the infant is Rh positive. So RhoGAM is given to Rh negative mothers to prevent the development of antibodies against Rh positive blood. This is crucial when an Rh negative mother has an Rh positive infant, as the mother's blood may see the baby's Rh positive red blood cells as foreign and develop antibodies against them, leading to hemolytic disease in the infant. RhoGAM is administered to prevent this immune response that is part of pharmacological and parenteral therapies. Sonu, I saw it come across my screen. But yeah, pharmacological and parenteral therapy, second largest section on the NCLEX at 14 to 18%. This is why you got to know it. Even though this is pharmacology subcategory, it follows under, maternal newborn, pediatrics, mother baby. All right. This is what you got to understand. All right. Here we go. So shout out to everybody that got that right. All right. Here we go. Hey, if y'all don't know this young lady right here, this right here is Stacy. I work with Stacy the month of November, parts of December. She took her NCLEX on the 21st, got her results on the 23rd of December, and she passed her NCLEX, y'all, on her 12th attempt. If that doesn't show perseverance and tenacity to really work and get for what you want, I don't know what does. And when I tell you she was coachable, she was 100% coachable. There were things that she was just doing and didn't understand. And her and I worked together. We found out what it was. And when I tell you she was rocking it, she was rocking it. All right. Anybody else that's interested or needs help with NCLEX, check me out. That link is in my bio. It's labeled NCLEX coaching. And if it's right for you, then we can get on a call, fill out the form, and, it's all about a relationship and how we can make things work for you. All right. So shout out to her. Shout out to Stacy, because Stacy she's a hard worker. I'm telling y'all that right now. Here we go. Question number 21. A first-time mother who is a pediatrician herself has recently given birth to twins. While one of the twins has been diagnosed with PKU, the other has not. She approaches the nurse with a series of technical questions regarding PKU, its diagnosis, and implications. Given her medical background and the unique situation of having twins with different PKU statuses, which of the following statements made by the nurse would not be correct regarding PKU? So what did the nurse say that was incorrect? Charlie says, I can't wait. Or is it Charlie? or Churley, Miss Churley. Can't wait to be a nurse. Hey, manifest it. It's coming. It's right around the corner before you even know it. All right. Is it what is it? The Girthy test can be utilized to check the necessary labs values for PKU diagnosis. In PKU, the urine typically has a high concentration of phenyl pyruvic acid. Mental deficits are often a clinical manifestation in individuals with untreated PKU. The effects of PKU, once manifested, are completely reversible with dietary modifications. Regular dietary management for infancy can prevent the development of symptoms. Or is it PKU is an autosomal recessive disorder, which explains this different statuses in twins? What are we thinking? Shout out to all 500 of you guys in here rocking. This is a pretty tough question for those that don't know it. So I'm gonna give you guys 15 more seconds, but shout out to everybody that's in here rocking with me. We are on our way to 30,000 likes. So make sure you guys smash that like button. Make sure you guys share and make sure you guys follow. Do I do tutoring for HESI? I do. I do tutoring for HESI. And you can check that out. That you could either do the private, it's like a private tutoring, a one-on-one where we talk about that, or you could do a package deal as well. So I do that for ATI. I do that for HESI. I do it from wherever. So, but here we go, y'all. Here's our answer. It says the name of the website, the nursery. It's this for these questions, Silver Moon nurseslabs.com. All right, but here we go. Oh my God, sorry, but the answer is D. Sorry, I know that's kind of highlighted and you guys can't see that. So let me fix that. All right, so yeah, the effect of PKU once manifested are completely reversible with dietary modifications. So that was incorrect. That was incorrect of what the nurse said. All right. It says it's an inherited disorder that increases the level of the phenylalanines. There we go. A building block of protein in the blood. If PKU is not treated, phenylalanine can build up to harmful levels in the body, causing intellectual disability and other serious health problems. That is part of the health promotions and maintenance. Smaller section on the NCLEX for their client needs, 6 to 12%, but still very, very much important. You need to know there are 8 sections of client needs that are part of the NCLEX test plan that you all need to know. All right. So just be aware. This is one of the 8. Okay. One of the 8. So shout out to everybody that got that answer correct. All right, here we go. I had no idea. I had to submit citizenship form to BON. Submitted yesterday, still waiting on my ATT. So actually, it'll probably take anywhere between 2 to 4 weeks. After 4 weeks, if you haven't received it, you need to be calling and being like, hey, where's my stuff? Question number 22. A 50-year-old male patient who is a known case of congestive heart failure and was recently diagnosed with osteoarthritis is admitted to the ER. The patient's wife reports that he might have taken an overdose of aspirin in an attempt to manage his joint pain. Given his medical history and the potential implications of aspirin overdose, which of the following complications should a nurse most closely monitor for during the acute management of this patient? Is it an onset of pulmonary edema, metabolic alkalosis, respiratory alkalosis, or Parkinson's disease type symptoms? What are we thinking? Shout out to all 400 plus of y'all. Hey, if you're new here, I want to know who you are, where you're from, and where you were at in your nursing journey. And if you're not a nurse, what are you doing here? Also, smash that like button, y'all. Give me the 30,000 likes. It's like less than 2,000. Y'all are just going to sit here and take all this information and not give me something that I want? What y'all think this is? Y'all think this is free? Y'all think TikTok is free? What are we thinking? Zion, is it Zion? Thank you for the follow. Or is it Zion? Xenon, girl of the 21st century? Cetus Lapidus? All right, I'm done. No more of that. Sue says, I'm saying B. Georgia, 12 years, different area of it. Okay, shout out to you, Kim. Zion. Like lion, but Zion. Okay, Zion. I got you, Miss Zion. That's a pretty name. Texas, shout out to Texas. Hey, I live in Texas too, specifically in San Antonio. So shout out to all my Texas folk. You know what I'm saying? Do you do LPN and NCLEX prep? I do. I'd actually do coaching for LPN and RN as well. So here we go, y'all. 10 more seconds. Erica, thank you for the follow. D, fluid overload. Where do you see fluid overload for D? I am totally lost. I'm from Ohio. Okay, shout out to Ohio. We got a lot of folks from Ohio in here, but here we go. Here's our answer in 3, 2, and the answer is, oh my gosh. All right. I don't know if it's the color or what, but the answer is A, an onset of pulmonary edema. Oh, I'm assuming that's what you meant. You meant to say A for pulmonary edema because you're talking about fluid, right? Aspirin overdose can lead to metabolic acidosis and cause pulmonary edema development. All right, pharmacological and parenteral therapies. Pharmacological parenteral therapy, second largest section, maybe A for, there we go. That's what I thought. I was just like, wait, fluid overload for D. Nah, that ain't it. So, wait, pharmacological parenteral therapy, second largest section on the NCLEX. That's what I'm talking about. We passing the NCLEX with this one. Hey, these are to help build your confidence, y'all. That's what these are for. They're to help build your confidence, help you get into the routine of studying, right? So you just think of hearing my voice, even though I'm not there, all right? Question number 23, a 50-year-old patient who is blind and deaf and has recently undergone a major abdominal surgery has been admitted to your post-operative floor. The patient has a history of anxiety and has been on medication for the same. As the charge nurse, considering the patient's sensory deficits, recent surgery, and psychological background, what should be your primary responsibility for this patient? All right, this is not a select all that apply. I just need one answer. All right, so what is it? Is it let others know about the patient's deficit, communicate with your supervisor your patient safety concern, continually update the patient on the social environment, provide a secure environment for the patient, arrange for specialized communication tools or interpreters to facilitate patient interaction? Or is it F, monitor the patient's anxiety levels and liaise with the psychiatrist for potential medication adjustment? What are we thinking? April says safety first. Treasure says D. Safety first, D. Okay, Chelsea. Chelsea says D. Shout out to all 400 plus of y'all on the road to 30,000 likes. Who said that? It says every other answer is wrong. Who's that? Is it Gober? Gober 122. You're gonna die on that hill? Hey, you ain't gotta. I see it. Stop spamming it before I block you. Stop. I promise you I will block you. Stop. 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 I see it. All right, 10 more seconds, y'all. Here we go. We got E. We got E. We got E. Okay. Here we go, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is D. The answer is D. Provide a secure environment for the patient. D's up. Shout out to D. Everybody that got D, that's part of safety and infection control. All right. This patient safety is your primary concern. Patient safety protocols can help reduce medical mistakes and prevent adverse patient outcomes. When the goal is to help people, it seems obvious that it's important to work to protect them from unintended or unexpected harm. Given the patient's sensory deficit, recent surgery, and history of anxiety, creating a safe environment becomes paramount. All right, like I said, safety and infection control, smaller section on the NCLEX. All right, but still very much important. Hold on a second, because obviously some motherfuckers just don't listen. So block. Obviously, no, we good out here. Like obviously, like bro, if you can't listen, then just go away. Like what kind of shit do you think this is? Do I look? I'm not your professor at school. Even if I was, I cuss you out there too. Don't play with me. Here we go. Question 24. A 72-year-old patient who is a retired minor, and not to be confused with someone who is under the age of 18, is getting discharged from a skilled nursing facility after a 3-week stay for a lower limb fracture. The patient has a history of severe COPD, likely due to his occupational exposure and PVD. He lives alone in a 2-story house and is primarily concerned about his ability to breathe easily, especially when he needs to climb stairs to his bedroom. Given his living situation, medical history, and concerns, which of the following would be the best instruction for the patient to manage his respiratory challenges? Practice deep breathing techniques regularly to increase oxygen level and improve lung function. Cough regularly and deeply to clear airway passages, especially before attempting to climb stairs. Use a bronchodilator and wait for a few minutes, then cough to clear airway passages. Focus on decreasing CO2 levels by increasing oxygen intake, especially during meals when metabolism is higher, or consider rearranging his living space to avoid frequent stair climbing. What are we thinking? Shout out to all 300 plus of y'all. Hey, appreciate everybody getting me to 30,000 likes. I appreciate everybody doing that. Hey, if you guys are new here, welcome. We're doing NCLEX questions. I already had to ban like 2 people because one was a bot trying to sell me nudies, which we can get for free. And 2, somebody just wants to be stupid. And so don't be that guy or gal. What's up, user 95? How are you? I'm gonna give you guys 15 more seconds. 15 more seconds. A, least invasive limb fracture. Okay, we got E. This man just had a COPD, so E. Okay, I got you. All right, y'all. Here we go. On his way to boarding care. Yeah. Maybe it's B, maybe E. Okay. Or but maybe E. I got you. Literally the first time, and already love you. Autumn, I appreciate you. I don't even know you, and I love you too, girl. Shout out to you. Here we go. Here's our answer in 3, 2. And the answer is C, cough following bronchodilator utilization. I know that's bright. Let me unbrighten this. And I know a lot of y'all are going to be like, oh my God, Kevin, why? That's stupid. I don't like it. Well, this is why you read your rationale, right? For a patient with severe COPD, deep breathing techniques can help increase oxygen levels in the blood and improve overall lung function. This can be particularly beneficial for activities that may exacerbate shortness of breath, such as climbing stairs, while the other options have their merits. Deep breathing techniques offer a proactive approach to managing the patient's primary concern about breathing easily. That is part of pharmacological and parenteral therapy. That's not real. Doesn't matter, Paul, if it's not real. That's the answer. Because remember, it's perfect. NCLEX is perfect world. Perfect world. Even with the new generation NCLEX, it's still perfect world. They just give you more scenarios so it looks more real world, right? Real world scenarios instead of just multiple choice questions and select all that apply. All right. But this is why it's important that you read your rationales. I knew it, but changed my mind when everyone else was. Emily, really? So you just decided to follow the crowd? What the world? Hey, ma'am, we can't do that. NCLEX is not perfect world. It's caregiver perfect. Well, I mean, tomato. Caregiver perfect. It's perfect world. I like, you know what, Kim, I like that. It's caregiver perfect. I can agree with that. Question 25. A nurse is assigned to a pediatric cardiology unit where she is caring for a 6-month-old infant. The infant was brought in by concerned parents who noticed that their baby was less active and had difficulty feeding. After a series of tests, the infant was diagnosed with a congenital heart defect. Right? Now think about, what are your congenital heart defects? What are they? Given the infant's age, recent behavioral change, and the diagnosis, which of the following clinical signs would most likely be present and should be closely monitored by the nurse? Is it a slow heart rate, weight gain, decreased systolic blood pressure, irregular white blood cell lab values, or increased respiratory rate? What are we thinking? We got some D's, we got some E's, we got some C's. Shout out y'all getting me to 32,000 likes. If you guys are new here, we're doing NCLEX questions for both RNs and LPNs. Got these questions off nurseslabs.com. You guys can go over there and check those out for yourself. They also have care plans over there for my nursing students that are in school right now. So make sure you guys go over there and check that out. All right. I'm going to give you guys 10 more seconds. 10 more seconds. We're on the road to 40,000 likes. Y'all can keep smashing that like button. Who am I to stop you? Took the NCLEX on the 20 and pass. That's what I'm talking about. Wait, hold on. Let me see that again. All right, y'all. Here we go. Here's our answer. Here's our answer in 3, 2. And the answer is B. It's weight gain. I've never had this problem where they just don't show up. I don't know why it's so bright like that. But anyways, it's weight gain. Weight gain due to fluid accumulation is associated with heart failure and congenital heart defects. When the heart does not circulate blood normally, the kidneys receive less blood and and filter less fluid out of the circulation into the urine. The extra fluid in the circulation builds up in the lungs, the liver, around the eyes, and sometimes in the legs, right? So that's part of physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. Hey, edema for fluid retention, right? So we're getting that swelling. Oh, Lordy. All I can say is that I am so thankful. Yeah. Why? Are you thankful for your knowledge? Like, what are we talking about? So, but hey, this is what you got to know. This is what you got to be prepared for, right? It says, I can't find the link to reach out for an appointment. So the link is inside. It is the coaching and it's the NCLEX coaching that is inside my link tree, which is on my regular bio page. Okay. Thankfully, I am not an advanced practitioner. That's okay. Hey, real quick. Hey, I'm working on putting a group together. I'm only going to be doing 10 people at a time, but I call it my 30-day tour of duty group coaching. So essentially, everybody that is getting ready and prepared for NCLEX, I'm going to essentially do what I do with my one-on-ones, but I'm going to do it for a group of 10 people and 10 people only. If you're looking to get onto that waiting list, you guys can go to thebootnurse.com/waitlist. And once I get everything set up, I'm going to send an email out to that group and that group alone saying like, hey, who's ready? First 10 people to jump on it will be part of the group coaching. So if you're interested in that, you guys can check that link out, which is also linked in my bio. In the link tree, it'll say that in there. Okay, here we go. Any tips on not changing your answers if you're unsure? Don't change your answer. That's just like me saying like, hey, do you have any answers for the fact that how do I lose weight? Put the fork down. I don't say that, Kayla. I don't say that in a disrespectful way, but you see what I'm saying. Do you recommend studying for NCLEX while starting their nursing journey? I recommend you start studying for NCLEX once you get closer to graduating. That's what I would say. Kayla, don't cry. Don't cry. Here we go. Question number 26. You are a pediatric nurse in a tertiary care hospital. At shift change, you receive a handover on a newborn who was delivered a few hours ago. The mother, a 38-year-old prima gravida, underwent prenatal testing, which indicate a high likelihood of Down syndrome, and the diagnosis was confirmed post-delivery. As you prepare to care for the newborn and support the mother, you review the common characteristics of Down syndrome, which of the following characteristics is not typically associated with Down syndrome. And it's not a select all that apply. It's just one of them. So which one do you think it is? It says being an RN has so many less criteria and less responsibility. I don't want diagnostic ability. Hey, Kim, some people do want that though. Some people want to just be like, look, I want to be a nurse, but I want to be able to just do my own thing. And, they have bad experiences with doctors where they misdiagnose. So they want to take it into their own hands to do things better. But, NP is not for everybody. CRNA is not for everybody, just like ICU is not for everybody and all the other good stuff. So shout out to everybody that's in here rocking with me. We're doing NCLEX questions, both for RNs and LPNs. Make sure you guys like, share, follow, get me to 40,000 likes. Give me to 40,000 likes. Hey, and here's the subject. If you don't understand this is nothing. All you need is to go and just look it up. Psych is where it's at. Depends. I can't do psych. I'll be ready to fight somebody. I went into a mental health facility and the whole time I was ready to fight. And that's probably not a good spot for me to be. All right, y'all, here we go. Here's our answer. Here's our answer in 3. It says, I'm already a pediatric nurse, but this is a good opportunity to keep up on knowledge. Shout out to you, Autumn. Shout out to you. First nursing job was psych. Mine was ICU. I worked in a burn ICU and I loved it. But the answer is C. Oily skin leading to potential acne later in life. Down syndrome, or was it the trisomy 21 is associated with a variety of physical characteristics. Hold on a second. Yeah. Why was it the Samian crease, the brachiocephaly, and the hypotonisi are commonly observed features in individuals with Down syndrome. Oily skin is not a typical characteristic of the condition. The other options provided, such as the upward slanted eyes and gap between toes, are also commonly associated with Down syndrome. NP, that's my goal. Go ahead, Ashley. Go do you. That's part of physiological adaptation, which is the third largest section on the NCLEX, 11 to 17%. Abby says, I take my NCLEX tomorrow and I've never heard of this. Abby, go away. Abby, you don't need to be on this live because I consider this live as cramming. You don't need to be here cramming. You don't need to do anything like that. All right. You need to be relaxing, and then you need to go take your exam tomorrow and then come back on Friday or Monday and let us know how you did. All right. So you have 2 choices. Either you go away or I ban you. Which one you want? That's all love. Nothing but love. Trust and believe me. OK, no studying the night before. This is considered studying, and I don't want you here. I want you to clear your mind and go chill. All right, here we go. Question number 27. A client with myocardial infarction is receiving Activase and TPA. While on the therapy, the nurse plans to provide which of the following? Observe for neurological changes, monitor for any signs of renal failure, check the food diary, or observe for signs of bleeding. Sorry, I'm trying to see if this girl's still here, because if not, I'm about to block her because she don't need to be in here. And I say that with love. All right, what are we thinking? Shout out to all 400 plus of you guys in here. Hey, appreciate you guys smashing that like button. Make sure you guys share. Make sure you guys follow. Also, another thing about me, for those that don't know and haven't been here the whole time, I failed my NCLEX RN 3 times. And no part of me cares about what you think. No part of me cares about what you think, because that test does not determine what type of nurse that you're going to be. You determine that once you get out there and you start working. All right. So don't let people come into your life, be negative, and start telling you all kinds of stupid shit where they're just like, oh, You failed that exam 3 times. You shouldn't be a nurse. Like, get out of my face, especially if you've never done it before. You see what I'm saying? So you will all go through your own trials and tribulations while you guys are studying for this exam. OK, so don't let people, ignorant fucking people, tell you what you can and can't do and what you can and cannot achieve. Trust and believe me when I tell you that, because I appreciate all y'all. Here we go. But the answer is D. Observe for signs of bleeding. Bleeding is the priority concern for a client with thrombotic medication. Thrombolytic medication, sorry. The primary mechanism of all thrombolytics is the conservation of plasmagen to the active form, plasmin, which then degrades fibrin, sorry, which is pharmacological and parenteral therapies. Once again, second largest section on the NCLEX exam at 14 to 18%. All right, 14 to 18%. I'll let y'all know how I did on Friday. Yeah, let us know. We do not have that ability. Kim, what are we talking about? What are we talking about? I love what you said about the NCLEX. Tiffany, I say that all the time. I posted Stephanie's video. If you guys didn't get the chance to see it, make sure you guys go over there and check it in my bio. But somebody literally got on there and said, oh my God, you failed this many times. I would never want you as my nurse. Well, you know, the good thing about your opinion is that it's fucking irrelevant, especially if you've never become a nurse or never even went through the trials and tribulations. But what other people don't realize is that she's been a nurse, an LPN, for 10 years. So miss me with that. You know what I'm saying? Miss me with that. You know what I'm saying? Your test doesn't define you. It's just an obstacle that you have to achieve in order for you to get out there to learn more. You know what I'm saying? I've already talked too much, so you guys read this and we'll go through the answer. I'll give you guys 20 seconds. Catania. Who's Catania? Catania, where you at? Like, raise your hand or give me some stars. The answer is A. Okay, Alana, I see you. There are people who pass the NCLEX on the first try that are dangerous nurses. Yeah, there are. I know tons of them too. All right, we got A, we got F. All right, leafy greens. Okay. All right, what else we got? Got F. All right, y'all, here we go. Here's our answer. Here's our answer in 3, 2, and the answer is A. It is green. Oh my goodness, I'm sorry. It is green vegetables like spinach and broccoli and liver for those who consume it. Folic acid, also known as vitamin B9, is essential for many body functions, including the synthesis of DNA and RNA, the metabolism of amino acids, and the formation of red and white blood cells. It's essentially crucial during periods of rapid growth, such as pregnancy. Green leafy vegetables like spinach and broccoli are rich sources of folic acid. Liver also contains a high concentration of folic acid, but it's important to note that patients' dietary preferences. The other options, while containing some amounts of folic acid or being beneficial in other ways, do not have a high concentration of green vegetables and liver. That is part of basic care and comfort. Basic care and comfort, right? 6 to 12%. Basic care and comfort is something that you guys learn in foundations or going into med surg. That's like right at the beginning. All right. Basic care and comfort, 6 to 12% on the NCLEX exam. Smaller section, but of course, very, very, very important. Did I say folic and folate? What did I say? I don't know what I said. If I read it wrong, my bad. Sorry. Here we go. Question number 29. A nurse educator, which will soon be me, is preparing a seminar for a group of new grad nurses who will be starting their careers in the pediatric intensive care unit. Given the vulnerability of the pediatric population to certain infections, the educator wants to emphasize the importance of understanding meningitis and causative agents. When discussing the microorganisms responsible for meningitis in humans, which of the following should the nurse educator highlight as not being linked to meningitis? So out of all of these, one of them does not contribute to meningitis. So which one is it? Is it pneumonia, influenza, meninginitis, or is it C. diff, Clostridium difficile? Probably the best smelling thing you'll ever smell in your life. Oh, shout out to all y'all. Everybody's giving D. We got C. diff. Okay. If you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. Lily, I'm kidding. I'm pretty sure you're making that face because you're just like, oh my God, he's lying. It's like, oh my God. Is it Rosie? Thank you for the follow. Appreciate you. All right, y'all. I'll give you about 15 more seconds. Yeah, Lily, I see you. All right, y'all. Also, hey, if you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. Where you're at in your nursing journey. Meningitis stinks. Does it though? Does meningitis stink? Does it though? Worst smell, C. diff, and GI bleed. Look, we can talk all day about GI bleeds, let me tell you, and I am not a fan at all. PA, PCT. Shout out to PCTs. Hey, right now I'm telling you, hey, if I have any patient care techs, if I have any MAs, X-ray techs, my respiratory therapist, who I love, y'all, X-ray, pharmacy, lab, lab if I don't get hemolyzed, telling me that my blood hemolyzed. Hey, I love all y'all. Y'all don't get enough credit and y'all don't get enough love and recognition. So I will recognize all of y'all, because if it's not for y'all, like, we can't get shit done. That's not just as nurses, but that's just as everybody. So shout out to all y'all that are out there, doing the damn thing. But the answer is D. It is C. diff. C. diff has not been linked to meningitis. C. diff is a germ that can cause life-threatening diarrhea. It is often a side effect of taking antibiotics. Antibiotics. When do you go live throughout the week? Monday, Wednesday, Friday at 5:30 Central Standard Time, Texas time, because that's the only time that matters. Physiological adaptation, which is the third largest section on the NCLEX, 11 to 17%. 11 to 17% on the NCLEX. I am from SoCal, LVN student. Shout out to you, Alana. I lived in SoCal. I lived in San Diego for a year. Loved it. Doctor's rule. That's debatable. Depends on the doctor. And it depends on, a lot of doctors really have this God complex and really forget that they're people and that they have to go home. And so, they really talk out the side of their face until you check them. And then they're just like, hey, okay, cool. So here we go. Question number 30. Question number 30. A nurse is working in a hematology ward and is administering a blood transfusion to a 40-year-old patient with chronic anemia due to a genetic condition. The patient, who is a biology teacher, is curious about the physiology of red blood cells and asks, considering the turnover and production of the red blood cells in my body, how long does a typical red blood cell live? Given the patient's background and the context, which of the following responses is accurate? Which one is accurate? The average lifespan of our RBC is about 45 days, after which it's broken down. RBCs typically survive for around 60 days in a circulatory system. Most RBCs have a lifespan of approximately 90 days before they are replaced. A RBC generally has a lifespan of 120 days in the body. The longevity of red blood cells can vary, but it's usually about 150 days. Or is it RBCs continuously regenerate and can live indefinitely in the body? What are we thinking? Hey, who was that turd in here that just said that doctors are superior? Let me tell you something right now. As a nurse who have saved many doctors and the mistakes that they write for orders, or they try to just do things that are just crazy, let me tell you something. Doctors are not superior. That's why it's a team effort. That's why it's a team effort. All right. A doctor that comes around and starts saying stupid shit like doctors are superior, trust and believe me. Trust and believe me. You have a rogue doctor or a rogue nurse, you don't want to be around those people, because they will literally put your whole livelihood at risk. I'm a med student. I think it's a bit wild that nurses change physicians' orders when we put them in. All right. I don't know who you are, user X112 or 12. I'm sorry, but as a nurse, I don't even have those keys to change your orders. You know what I'm saying? That's the thing. It's just like people have this God complex and the ego thing to where, it's supposed to be a team effort. You know what I'm saying? So shout out to all 569 of you guys in here rocking with me. My man, James, I see you in there, sir. I see you in there. Hey, if you guys are ever interested in learning about AI and creating digital products, my man, James Ward, who just popped up in here, actually one of my silent mentors, great guy, definitely great. You guys go over there and check out his page. He's a business mentor, great guy. I'm a lot better looking than him, but he is older than me, so I kind of give him that grace of elderliness. But here we go. Here's our answer in 3, 2, and the answer is D. The answer is D. I see you, James. Hold on a second. Let me take this off because obviously this is wild. But the answer is D. A red blood cell can generally have a lifespan of 120 days in the body. Red blood cells have a typical lifespan of about 120 days in the body. After this period, they are removed from the circulation and broken down in the spleen and liver. The components are then recycled to reduce or to produce new RBCs in the bone marrow. This continuous process ensures that the body has an adequate supply of fresh RBCs to transport oxygen to tissues. That is part of physiological adaptation. That I should already know that. Autumn. So you're right. They should know that. But I think you got to think, if you're a nurse and you're being taken care of by another nurse in a hospital, you can't help but want to start to question and start to want to quiz folks. I can't help it. I do it too. But I do it in a very respectful way, unless they're doing something completely just wrong. Physiological adaptation, 11 to 17% on the NCLEX exam. All right. Remember, you need content, Q&A, rationales, ladies and gentlemen. But ladies and gentlemen, that is it. That is it. That wraps it up for the questions for today on this Wednesday. I appreciate everybody for hanging out with me and participating. Remember, when you guys hang out and participate, that is what drives the algorithm to get people here who need it. I'm sure I got some new folks in here, and I appreciate all you guys being in here rocking with me. But before you guys go, I'm actually going to do an Ask Me Anything, where you guys want to ask me questions about whatever, nursing, all that good jazz. So you guys are very welcome. You guys are very, very welcome. Everybody's asking what a 600 is. That just means I banned people. I had to ban somebody who was spamming in my fucking chat, and I trust and believe me, I don't got no problem banning you. I forgot what their name was. That's how unimportant they are. Nurseslabs.com is where I got these questions from. You guys can go and check those out for yourself. Also, 7-day NCLEX course. Anybody that needs an NCLEX course, go over there and check it out. You get it for $97. And you get all the updates and you have it forever. That is my gift to everybody right now, because we're still uploading it. We're still uploading, we're still updating it. There's going to be over like 200 content videos that are going to be in there that are going to help you. I also have a new generation NCLEX review that's in there. It's almost 4 hours worth of just going over Q&A and then showing you little tricks and memory tricks and stuff like that. Also, there's a free download. Go over there and check that out, as well as, hey, if you're looking for tutoring, coaching, or any of that good jazz, y'all can go over to my bio and y'all can check that out. Hey, what's up, y'all? How y'all doing? My name is Kevin. Sorry if it's bright up in here, because this light obviously doesn't want to cooperate with me, but I appreciate everybody being in here rocking with me. If you guys are new here and don't know me, my name is Kevin. I go by the Boot Nurse on all those social media platforms. So if you want to Google me, please do. Been a nurse for 3.5 years. Jason Derulo. Look, I need that Jason Derulo money. Gabby, you're welcome. I'm about to take my NCLEX. I'm about to take the NCLEX for the third time. What helped you the most? That's a real convoluted question, but the one thing I can tell you is accountability and time management. I love the download and the victory thing and all the email tips from you. Thank you. Ashley, I'm so glad you were able to tell me that, because I remember I said, hey, I want feedback because I want to be able to make them better. You do look like him. Yeah, I get told that a lot. I'm a new grad and I like today's live. I will come again. Is it Geet? I'm glad that you like the live. I want you to come back. And do these. I'm actually going to start doing stuff off of TikTok, to where, I'm actually going to go through lectures. So, those real important lectures that you guys want and need for NCLEX, like cardiac meds or test taking tips, prioritization, respiratory, mother baby safety, all those things. I'm actually going to be doing those things off of TikTok. Here comes soon. So make sure you guys keep coming to the live. Make sure you guys follow me so you guys will know when I drop those. Okay, because they're gonna, Lord of mercy, they're gonna be a lot more. They're gonna be a lot more intense than these questions that are on here. Okay, so, and plus, what that does, it helps weed out the people that don't need to be there, that come here that try to tell me how to do my live. You know what I'm saying? So let me see what other questions. But what questions do you guys have? How long should I study before I take the NCLEX? Nathan, that really just depends. If you're in school, you should start studying like a month before you graduate. So that puts you at about 2.5 months before usually you get your ATT, and then you can sit. But if you've been out of school for a while, you want at least like 30, nothing less than 30 days, no more than 90 days. Okay. I have tried online courses and in-person courses and have not been able to pass my fourth time. Is it fee or fee? Hey, maybe you just need somebody to guide you. Like some online things just aren't well for people. Some online courses just aren't well for people. If you need one-on-one guidance, I can do that. You can check that link out in my bio. All right. Says good. Yes, definitely. We'll look at that. Okay, Ash, like we're cool. Shout out to you, Ashley. It says doing LPN in Canada in my last semester this January. Glad I found you today. I'm glad you found me too. Is it Bungie? Hopefully I said that right. Prioritization, questions, please. So I usually do prioritization questions every so often, but usually when I pick out my questions, they're random. So we'll see how that goes. But I will be doing, like, essentially what I'm going to do is my lectures that are going to be inside of my course, I'm actually going to do them like off. So it's just like a one-time thing. And that's the thing. It's just like, who would pay for that? Like if I said, hey, y'all, first 200 people, it's $10. It's $10 for us to be in there for an hour and a half for me to go through a lecture, the important things that you need to know, do an NCLEX question at the end, and then, do a short Q&A. I think a lot of people would like that. I'm a nurse and I like watching you to keep my knowledge update. Thank you. Kelly, you're very welcome. I listen to NCLEX review consistently when studying. I listen to everything I could. Dudley, so here's the thing is that it could be too much that you're listening to, and then you got to find that one specific thing that may work for you. Like there's all different types of reviews that are out there, all different type of reviews. Like you got Kaplan, UWorld, Hearst, Archer, NCLEX High Yield. Like you got a whole bunch of them, Remar, you got a whole bunch of them that are out there, but you need to figure out which one works for you. They've all been around. Some of them have been around for quite some time, and they have, the social proof to show that they work. Just like my course. My course is brand new. It's been around since June, but I've already had massive amounts of people tell me that it's worked for them. You know what I'm saying? As we continuously update it, right? So I spent over 4 Gs to get 2 different refresher courses and I got absolutely nothing from it. So I spent $3,000. Hear me, all 116 of y'all. I spent $3,000 on testing, on reviews, on stuff like that before it just clicked. And you want to know what made the difference? Is it Honeylove Norman? It was a mentor. It was one person. Hi, I'm from Kenya, working in England, processing to move to the U.S. My NCLEX is in February. Shout out to you, Marie. Marie, I think you told me that before. What's up, Ashley? Oh, Ashley, I know you're down for that. Tips for bad test takers. So that's a very filled question. And here's what I'll tell you is for bad test takers, mostly it's anxiety. To get through your anxiety, you have to practice. But then so a lot of people just don't know like what to practice. Like, they tell you like, hey, go buy this, but nobody like really gives you guidance, right? So maybe you just need guidance because I was a bad test taker. I mean, I didn't think I was a bad test taker. It's just I didn't know what to study. And then when I had a mentor who guided me on what to study, that is what worked. So Kayla, for you, that could be something that you need. Dudley says, no, I passed my first time. Oh, okay. Was just offering what worked for me. Oh, okay. I got you. I'm picking up what you're putting down. I got you. Me too. And didn't pass. So Michelle, here's the thing. At some point, it's not about the reviews. It's not about the courses. It's about you. At some point, it's about you. Everybody's going to be like, oh, like a lot of that. When I failed my NCLEX, majority of it is me. Like 90% of it. No, 100% of it. Everything was my fault. Until I had to figure out what to do, right? We have to pay $500 per semester for ATI for our school for us to prep for NCLEX. Yep. There's some people that do that. Kayla, don't read into the question. Don't change your answers, right? Thank you. Tips for someone who want to go back to school. Go back. Monique, I don't know what you wanted me to say, but go back. Do your research. Instead of sitting online, instead of sitting on TikTok, while you're on the toilet scrolling and laughing at stupid shit, because that's what I do, utilize your time and start looking like, I want to go back. I want to go back to school. Well, let me start looking at what I can go back to school for. You know what I mean? Exactly. The guidance is the key. Facts. It is. How do we sign up for mentorship? What is the process? So if you want to sign up with mentorship and coaching for me, that link is actually in my bio and it's labeled NCLEX coaching, where I coach you through NCLEX, like 30 days. All I ask is 30 days. And here's the thing. If you're not coachable and if you can't have a mindset shift in 30 days, and if you're not open to suggestions to change your ways, then I won't work with you. I flat out say that I won't work with you. It's built into our tuition. It's required. Yeah, that's usually how it goes. I need to pass NCLEX. Utmost, if you need to pass NCLEX, what are you doing to prepare yourself for that? That's where I'm at now. Just need some help. I don't know what to do. Michelle, same thing. Like I said, same thing. You're looking for coaching. You're looking for something that's one-on-one, that's tailored to you, where it's, imagine getting this one-on-one with me. where we talk about it back and forth. That option is available to you. You can check that out. That link is in my bio, but I also have other things that are there too. There's a course, there's an ebook, like whatever you want, not whatever you want, but for the most part, like whatever I have right there. So I'm confused on how to go about NCLEX registration. Lily, what do you mean? Like, you got to give me a little bit more context. Fee, you're welcome. Go to the Board of Nursing, depending on your state. Yep. Dudley says, you are awesome. This is such a good service. I watch for refresher anytime I see it. I appreciate it, Dudley. I appreciate you. I got you. I will. Thank you. Yeah, you're welcome, Michelle. So yeah, Dudley, I like doing these because I do other things. Obviously I do other things. I create a course. I still upload and update my course. The holidays has made it a little bit different because, slowed down, people relax and all that good jazz. But, the ebook and then, the coaching and all this other good stuff. So, I try to, give this as well as all of my recorded sessions end up on YouTube as well. So if it's helpful for somebody, then, it's helpful for somebody at that point. Do you help students in nursing school? So I usually don't help students in nursing school. However, I actually just started mentoring and coaching a student who is in nursing school. And the reason being is because if I start doing that, I'm going to have a lot of people. And my biggest bread and butter is helping people through NCLEX. Not saying I can't help nursing students, but depending on whatever's going on within nursing school or within whoever the person is, the biggest thing is like, do you fit? Do we fit? As somebody who is like, you're looking for tutoring and coaching, like, do we fit together? But to answer your question, Ashley, yes, I do coach some people that are in nursing school now. It's been one of the biggest requests, and I finally did it, and some people jumped on that. When would be your next live? My next live is on Friday at 5:30 Central Standard Time. PM. Somebody asked me, is it AM? Like, obviously, it's not going to be 5:30 in the morning. So I'm in Canada, but licensed in my country, Nigeria. But I'm confused on how to start my NCLEX journey. So the very first thing that you need to do is, since you're in Canada, you need to go to the National Council or you need to apply in order to take the licensing exam here, Lily. That's what you need to do. So you need to go to the National Council of State Boards of Nursing. And then they're going to actually give you, there's like a whole list of things, like a checklist of what you need in order for you to start being able to take your exam. Is it Rondine? It says, I'm in my second semester of my LPN journey. Start med-surg and pharm right now. Any suggestions on studying? I would tell you, right, for pharmacology, you need to understand, like, if I talk about cardiac meds, you need to understand what falls under that umbrella. You need to know the expected outcomes of those medications. You need to know what falls under those umbrella of those medications. So cardiac meds, ARBs, ACE inhibitors, beta blockers, calcium channel blockers, DIG. You need to know the safety implications, when to give it, when not to give it, so on and so forth. That's how you need to know that. With med-surg, same thing. Get into a group, small group of people. You, 3 other people, split the work up 25%. If everybody does what they're supposed to do, you do 25% of the work and you reap 100% of the benefits. So think about that. I'm definitely coming to you when it's time for my NCLEX. Well, come on. Never mind, I saw it. How long are your lives? Okay. The lives are essentially as long as I want them. The questions took me a little bit longer, like 10 minutes longer today. So how soon would you recommend we start studying for our NCLEX? Is 30 days enough? That depends on you. Do you need more than 30 days? Some people need 30. Some people, I've coached people that have taken their NCLEX in 2 weeks and they were ready. There's other people that have taken 45 days. Some people have taken 60 days. I say no longer than 90 days. At that point, if you don't understand, like, what have you been doing for the last 3 months of your life? You know what I mean? So I failed my first quarter and now I passed my second quarter. That's what I'm talking about. Rondine, you are welcome. Since I'm a nurse already in my country, do I need to go to nursing school in Canada? No, you don't. You just need to apply in order for you to start working in Canada, because Canada and the United States, they take the same exam. So you need to apply to get your license here in the US. Or I'm sorry, in Canada. In Canada. All right. But shout out to all 70, 80 of you guys in here rocking with me. I appreciate it. You guys got me to 40,000 likes. Like I said, whatever question that you guys have, drop them down in the comments and I'll try to answer them as fast and as quickly as possible. But like I told you guys before, I failed my NCLEX 3 times. 2018, twice in 2019, took it in 2020, and I passed during when they started shutting everything down, right around COVID. I had 60 questions. By the way, people were still failing when they had 60 questions. I'm just letting you know that. The standards didn't change. But here's the thing I'm going to tell you. Nobody cares. Nobody cares. I had people come to me and say, oh, like, I wouldn't trust you because it took you that many times to take the exam. Like, no patient is ever going to ask you how many times you took your licensing exam. They just want you to take care of them. I've met some terrible nurses that have passed their NCLEX on the first time. That NCLEX does not, that licensing exam does not define you. Nursing school also does not define you. I need to apply to get my license in Canada by writing the NCLEX. Correct. Unless, because you say you're from Nigeria, unless when you took that exam, it was given by the National Council of State Boards of Nursing. Unless like it was given to you while you were in Canada, but I doubt that because most people that live in different countries, they take they do all their stuff from their country and they move here to the United States, and then they still have to take that licensing exam. Okay. Who is it? Oh, Lily, you're welcome. I had a coworker that came from Colombia. She had to apply to take the NCLEX and then was good. Yep, exactly. I've coached people from Colombia, Puerto Rico, the Philippines, Africa, different countries in Africa from since Nigeria and Ghana and Gambia. I had another one from the UK. So, I've coached a bunch of people, and that's essentially like when you come here, that's what you have to do. That's just what their criteria is because, to do nursing there, it's not necessarily all that different, but you have apparently, the United States and Canada is the peak of nursing when it comes to knowledge and all this other good stuff. Like I said, apparently, I didn't say that it was true, so don't be coming after me like that. All right. But yeah, also been a nurse for 3.5 years, y'all. I've been a nurse for 3.5 years. I've worked in 3 different ICUs. I've worked in the PACU or the recovery room, post anesthesia, as well as I have worked in the operating room. I've been in the Navy for 16 years, surge tech in the Navy, a master instructor in the Navy, as well as a hospital corpsman, which is equivalent to an LVN, right? So I did all that, enjoyed it, learned a lot. So a lot of people ask me, hey, why don't you work in a school? I mean, y'all hear how my lives go. The school would fire me. They'd be like, oh, no, that doesn't align with our core values. Well, let me tell you about my core values. It's about keeping it all the way honest. I'm just letting you know that right now. What has been your favorite place to work? You mean favorite area, Ashley? Favorite area of nursing to work? My favorite area of nursing to work has been the PACU. No needing studying. Again, the best is just to go straight for NCLEX and then license. Yep, you can do that for sure, Lily. 100%. Ashley, yeah. So yeah, it's definitely been the PACU. The PACU was great is because, you get 2 patients at a time. You essentially have all the help that you could possibly want. Anesthesia's not far behind because the OR's right there. You usually have patients they're in there for 30, anywhere from 30 minutes to an hour on average if they don't have a bed issue. And then you transport them up to their floor and then you just go on that rotation. Before you know it, your day's already up. A lot of people say, oh, don't go to PACU because you lose your nursing skills. Bro, don't nobody care. Don't know that's what you don't want from me. I don't care what you want. I'm trying to go to where I'm enjoying myself. If I want to go to PACU and enjoy myself, that's what I'm gonna do. So, but yeah, it was definitely the PACU for sure. But what other questions do you guys have? I've got 70 people in here rocking with me. I always think about trying PACU in research now, but you never know. That's facts, Dudley. That is facts. I do education right now, and I just essentially work from home. But I'm working on a nurse navigator position where I work with specifically a physician, getting them taken care of in the clinic. So I'm totally okay with that. Ashley says that's what I've heard during my clinicals, that we lose our skills. Same with the OR. Who cares, Ashley? Yeah, and the thing that's really crazy is they act like you can't get those skills back. It's just like riding a bike. You know what I mean? So is there any kind of clinical or practical aspect of the NCLEX? So the whole point the whole point is to, I always used to think of it as a racket, but the whole point is just to, what I'm trying to find the exact word. It's to make sure you at least have the basics of what they're talking about. That's the practical aspect, is because if you don't take it, like, I'll give you an example. When they had that whole fake nurse thing going on, this is for, is it Dr. Awesome? Dr. Awesomer. So when the whole fake nurse thing was going on, we had people that didn't even know, people that were working in hospitals that did not know the basics of the basics. So we had a patient who had end-stage renal failure. I'll give you an example. And, the nurse decided, it was like, oh yeah, let me give them an oral medication of Tylenol, right? Which is a no-no for somebody who has end-stage renal failure, right? So when that happened, or you start saying things that, you're supposed to know, like, hey, I know that the generic name for Tylenol is acetaminophen. If you have somebody who doesn't understand the lingo, how in the world, in the absolute world, can you vet them of being a nurse? So essentially the practical and the clinical aspect is showing that you have hit all the wickets to be a bare minimum nurse in order to take this exam. Hopefully that makes sense. I probably could have articulated that like way, way better, but I think you get the gist of what I meant. Please, do you know the right place to go in Canada and rent? Yeah, in the National Council of State Boards of Nursing. That's it. Put National Council of State Boards of Nursing, or ncsbn.org. That's where you want to go, Lily. That's where you want to go. You can always relearn anything. Facts. Like when I hear people start telling me, they were just like, oh, don't go to the OR. Like, shut up. Shut up. Get out of my face. Like, thank you for telling me where I want to go. That's just like when people are just like, oh, you need to go to med-surg before you go to ICU. That's also not true, because I started in ICU and I worked there for a year, or a little over a year and 3 months. So when people start telling me, oh, I don't need to do nothing. So I love being in the OR, right? That's what I was thinking about. It's always going to be ingrained in our mind. It's always going to be ingrained in your minds for sure. It's always going to be ingrained in your minds for sure, because it's a very old school way of thinking. Like, oh, they want to try to like pipeline you. Everybody needs to go to med-surg before they go anywhere else. Is there anything wrong with going to med-surg? No. National Council of State Boards of Nursing. So N as in November, C as in Charlie, National Council, S as in Sierra, B as in Bravo, N as in November, .org. So National Council of State Boards of Nursing, .org. And I like the OR. I like the OR. And honestly, it depends on like wherever you go, your places will differ on, how well you'll like it. How long have you been in the OR? So I've worked in the OR. Oh my God. I worked in the OR as a surge tech from 2010 until, I've been a surge tech for 13 years. I still have my national certification. And then I started working in the OR as a nurse in 2022. So March, it'll be 2 years. So that puts me at like a total of like 13 years between the two of them, right? So I'm supposed to start in the seizure and epilepsy unit on the 16th as an LPN, as long as I get my ATT. Shout out to you, Ash. You got it? Cool. Got you, Lily. Got you. I'm glad that worked for you. At least you have a starting point. Lily, at least you have a starting point. I so much. You're very welcome. No problem. But yeah, actually, that'll be cool. Learn about seizure precautions, neurological issues. Who knows? You might like neuro and end up going like neuro med-surg or neuro OR. No, neuro OR. You might go neuro ICU. Who knows? I'm an emergency room tech, and when I finish my nursing in December, I will stay in the ED. Cool. Stay in the ED then. Like I said, like they want you to go to med-surg, but you don't have to go to med-surg. It's where I did my preceptorship and I loved it. That's good. I'm glad that worked out for you. And that's another thing too, is like, if you're one of those individuals who, like, if you're a patient care tech and you work somewhere, you already have built that rapport with the nurse managers and the nurse directors, and they already know who you are. So once you go from patient care tech to nurse, LPN or RN, those are the people that are going to vet you to put you in there. Tips on drawing blood, practice. Tips on drawing blood. There's a systematic approach on how you do everything. So follow that systematic approach, step 1, 2, 3, and 4, and practice. That's the only way you're going to be good to get better at those practical type of things, is you have to practice. So that's for you, Kristen. Do you think it's possible to start as a new grad in the ER? Yes, Zay, 100%. 100%. All you got to do is, all one needs to do is apply. But shout out to all, how many people I got in here? 60 people. What other questions do you guys have? I'm going to hang out for about another 5 minutes, and then I'm going to get off. You know, your boy got some stuff he got to do. But what other questions do you guys have? Appreciate everybody getting me to 40,000 likes today on this Wednesday. I think we had about 700 people in here that were watching at one point, on average between 300 to 400. So I'm glad everybody has found value in this. And I'll keep providing value, but I'm also going to be doing things off of TikTok to provide people more value that, you know, have a little skin in the game, because obviously people here on TikTok just decide that they just want to lose their mind. And so I'm trying to rectify that a little bit. So what other questions do you guys have? Dr. Amar, I'm starting nursing school Monday. Okay. I'll be the oldest of 51. No one cares how old you are, Dr. Awesomer. What should my nickname be? Well, I don't know. I don't know, Awesomer. It says just here to show love. Trey, I appreciate you, brother. You missed it. I had like 700 people in here earlier. Dr. Awesomer. I don't know. Are you male or female? And if you're a male, I'd say we call you Pops. Yes, please continue. I got you. Writing in a particular province can be used in another province. What do you mean? So when you take your exam, you can take your exam anywhere as long as it's a certified testing center. So, for example, I live in Texas. If I went on vacation to visit my family in Florida, I can take my exam in Florida. Yeah. Yes, male. And I can live with Pops. Yeah, you can live with Pops. Okay, that's cool. Like, because people are probably, I don't know. I feel like people will come up with some other stupid shit for people. So I still struggle with documentation. So documentation comes with time. I actually do have my own like mentorship program where I still mentor one-on-one and I have a buddy, one of my mentees who I mentor right now, who is in a cardiovascular ICU, and, he's having really bad imposter syndrome right now. And he was just like, I think I should leave. And I told him, if that's what you feel you need to do for yourself, go. And the reason being is because no one's more important than you. And lastly, the last thing I want for you to do is to make a mistake working there. If you feel that you may have bitten off more than you can chew, that's cool, because guess what? That ICU ain't going nowhere. That OR ain't going nowhere. That ER ain't going nowhere. Trust and believe me. As soon as you say that you want to leave, they're going to fill that spot. Don't even worry about it. Go to where you feel you need to get what you need to get for yourself, and then come back. Best believe, trust and believe me, if you're a nurse, LPN, RN, you are a hot commodity, and don't let people out here tell you that you are not. All right. So Zay says, I appreciate your work. I appreciate you here, bro. I appreciate you, brother, being here. Like writing in Alberta, Providence, can it be used in Ontario? Yeah, it can. Can it be used in another country like the U.S.? So the U.S. and Canada take the same exam. Lily, okay. Do you know anything about the compact nurse? Zay, I know a lot about that. But what you could do, essentially what the compact nursing licensure is, or it's called the nursing licensure compact, it allows for you to work in different states, right? Without you happening to immediately, get that state's board of that state's license. It's a little bit more in depth than that, but you could literally just type in nurse licensure compact, and then it'll bring up a map, and it'll tell you all of the states that are a part of it, which I want to say it's like 45 now. I think Washington was the latest state that became part of it. Can it be used in another country? Yeah, we already talked about that. Do you know anything about, we talked about that. Do you need to have an associate's or BSN to take the NCLEX? Yes, you have to have at least, okay, I take that back. It depends on what NCLEX is. Natalie? It depends on what NCLEX you're taking. So if you're an LPN, so a licensed practical nurse or licensed vocational nurse, you'll take the NCLEX PN. Now, if you're an associate's degree RN or an associate's degree or baccalaureate level degree, you take the NCLEX RN. So two different NCLEXs, same concept though. How much is your course? It's $97, and you get it for a lifetime, Michelle. Ashley says, definitely needed to hear that. Thank you for the confidence boost. You're welcome. I have a full-time job already, and I want to be a nurse on the side. Are per diem positions common? I couldn't even say your name. Dr. Osmer. Yes, 100%. There's tons of nurses that only do per diem, only because they make more money doing that. So some of them like, yeah, I only work twice a week, but it's only per diem and I get paid like, $75 an hour or whatever, depending on wherever they are. So it really all just depends. Lily says, okay, I'm an LPN going to do a bridge program starting in June, and I think your stuff is very helpful. Is it Leah? I appreciate you. I'm glad that you think it's helpful. Like I said, I'm doing stuff here. I'm going to start doing stuff off of TikTok. That's going to be even more helpful. But of course, I want people that have skin in the game. I take my test in 2 days. I'm so nervous. Is it Lillian? That's okay. You're going to be nervous. Two things. If you're scared, go to church. That's number one. Number two is you're going to do it anyway, and you're going to be nervous. It's a part of it. No one ever accomplished anything good and wasn't nervous when they did it. Okay? Think about that. And remember, this test is to keep people out. It's to keep people out. So are you worthy enough? Are you worthy to stay in it or to be a part of it? I don't know who I just invited. It was totally by accident. So I have to uninvite you. But yeah, what other question you guys have? You guys are coming at me with the questions. I was about to get off, but I'm trying to see. I'm trying to see what's good. It says, thank you for the wise words and knowledge. Good night. Kristen, you are very welcome. Hey, for everybody that's here, make sure you guys share, make sure you guys follow, and make sure you guys like, because that is what gets this out to more people that need it. Will your course always be $97? For right now, it is. Right now, Ashley, it's $97, and I have 61 videos in there. As a matter of fact, here, I'll do this, because I know a lot of people are just like, what does your course have, and so on and so forth. So like right now, I have 60 something videos that are in there to include a new generation NCLEX review. Now, Ashley, will it always be $97? No, it will not always be $97. At some point, it's going to go up. And not only is it going to go up, it's going to go to subscription based. Do I know when that's going to be? No, not yet. But just know it's coming. I'm saying it right now on record, is that at some point it's going to go up. All right. But once you get it, if you get it now, you have it forever. You have it forever. But what other questions? It says BSN, ADN, and NCLEX are different. No, they are the same. The ADN and BSN RN NCLEXs are the same. It is on sale. So the normal price of my NCLEX, Lily, thank you for the heart. I appreciate you. The normal price of my whole NCLEX review, even for the whole thing, it's $347. But right now, it's $97. It's $97. Now BSN, now RN, NCLEX RN and NCLEX PN are different. Can you take the NCLEX RN with an associate's degree? Yes, Natalie, you can. You can, for sure. They actually have, they have their own. No, I take that back. They don't have their own. But so the biggest thing is, like, if you have your associate's degree as a RN or as a nursing student, it's the same test as the BSN. The only thing that's different is the amount of schooling that you get from the associates from the BSN. Mostly like research and like, not psych, but like research and those other big ones. Excuse me. So I'm going to show you guys what it looks like. I know somebody was asking. So it says, how can I get it? I'm starting my, is it a Cody? What do you mean? Ashley, you're welcome. How long is the NCLEX RN exam? Do people run out of time? The RN NCLEX exam and LPN exam. At least my smoke detectors work. I'll be right back. Hold on. I thought you were making one. Oh, okay. And so shout out to my fire detectors, right, for working, you know what I'm saying? Because, we ain't got to go up there and change them, you know what I'm saying? Because we got upgrades, you know what I'm saying? But yes, you can run out of time. Yeah, 5 hours to take the exam, both for RN and LPN, Lindsay. Hopefully that makes sense. Oh, I got you. I misheard you. Okay, no worries, Dudley. What you burning over there? I ain't burning nothing. Someone else is over there burning something. So I had to go be like, oh my God, what are you doing? How can I get into your class? So my class is on demand. You can check that link in my bio. Once you click the link tree, it'll say 7-day NCLEX course. And it is an on-demand self-paced course. All right. And like I said, once you get it for $97. It is yours forever. That means you get all the updates. Glad it was a false alarm, right? That's what I'm saying. Like, I don't need my house burning down. Where I'm gonna live then? Where I'm gonna live? All right, here we go. Let me show you guys what it is. So real quick, this is what the inside of the course looks like. I'm sorry if that's so bright. I'm trying to figure my life out right now. But this is what the course looks like. Is it for LPN2? 100%. So I go over videos talking about Ashley, these are going to look kind of familiar to you, right? You see that video that's right there talking about computer adaptive testing and, answering NCLEX style questions, right? But then we go down here. So part of the 7-day review, right? I have days 2, 3, and 6 in here. So days 1, 4, 5, and 7 are going to be added up here, here within the next coming weeks, right? But then I also have a new generation NCLEX review where we go over case studies. I break these questions down for you. I tell you why these are incorrect, and I tell you why that these are also correct. And not only do you get the content right here, let me show you. Now, I'm sorry, not only do you get that review, but you also get content, right? Hey, my NCLEX, my repeat test takers, I made a video specifically for y'all. Why? Because I understand what it's like to have failed my NCLEX, right? And I talk about ways to help you improve on your on retaking your NCLEX exam. And then down here, check this out. There's more content. Look at pharmacology. My pharmacology section right here, y'all. Let me show you. I'll kind of zoom in. My pharmacology section right here, there's 18 videos. 18 videos. And these are all the things that you need to know. The most important things that you need to know to help you for NCLEX. Is it right to start NCLEX classes before registration? What do you mean? You have to register in order for you to take the NCLEX, right? And we'll talk about fluid and electrolyte. As a matter of fact, my cardiology section, I actually got back, a bunch of my lectures, right? And I'm actually quality controlling them right now to make sure everything is right. But there's 9 additional videos that are going to go up here talking about AFib, AFlutter, VTAC, VFib, talk about sepsis. We talk about shock. I have an EKG or ECG interpretations course, right? Where I talk about how to interpret EKGs, which I know is probably one of the hardest things for people, right? But, got a bunch of stuff that's over here. As a matter of fact, let me show you. This is what's part of the case studies, right? I'm going to show you guys a case study. Does that look familiar? Looks like a bow tie to me, right? And then you guys will also start to see the pauses that'll happen in here, because that's telling me that you need to take the time to look at your questions and I want you to answer them, and then we go through them together, right? And then look, bow tie, look, what else? Where's my case study? Case study right there, right? And remember, your case study will consist of at least 6 questions per, right? Does the program have CAT? Actually, it does not. Actually, 7. It does not have, I don't have a Q bank. Mine is just strictly content at the moment. And question banks are coming later in the future. That's a 2024 checklist type of thing, okay? But yeah, that's what it looks like, right? That's what it looks like. I'm going to turn this camera around. All right. So yeah, so that's what the program is. That's what the program is all about. Like I said, once you get it forever. So whatever I add in there, you get, so like right now, working on the cardiology section, that stuff is going to be recorded. As a matter of fact, that's going to be one of those, what I like to call the skin in the game type of lectures. Like imagine, like I have ventricular, the biggest difference between ventricular fibrillation and ventricular tachycardia, where we talk about it, right? And then I give you an NCLEX question at the end, and then we do a Q&A. Who wouldn't want that? That way they can understand that. You know what I mean? So shout out to everybody who is still part of the live. I stayed on. I was about to get off, but everybody started asking me tons of questions. So if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Also, if you're not a nurse, what are you doing here? Dr. Awesomer, I had no idea. I don't know if Dr. Awesomer is still here, but I had no idea that I don't know why I thought you were a nurse, but I remember you said something about, I think you have your PhD or something like that. I can't remember. So, but yeah, what other questions do you guys have? What other questions do you guys have for me? Let's see. Got 47 people up in here, so I would think at least one of y'all would have a question. I think Lily had asked, is it right to start NCLEX classes before registration? Now, Lily, if you're talking about studying for NCLEX, like with your, like knowledge, like with my course and stuff like that, yeah, you most definitely can study before you take your exam. But I could have swore you just said that, oh, I already graduated. I took everything, from when you were in Nigeria. So now you're just going to go take your exam, which you very well could do. You very well could do that as well. All right. What are we thinking? What other questions do you guys have? Hey, if you guys are new here, like, of course, hey, a little bit about me. I've been a nurse for 3.5 years, worked in the OR, worked at ICU, worked in the PACU. And now, I essentially kind of just work from home now. But I'm working on, getting some other things. By the way, just because you become an RN or an LPN does not mean you have to work bedside. I don't care what those crusty ass nurses tell you in school. I don't care what those people that are miserable in a fucking hospital tell you. You do not. Just because you are a nurse, an RN or an LPN does not mean you have to work bedside. You can go work in a clinic. You can go do work in the pharmaceuticals. You can do work in the insurance spaces. You could, oh my God, there's so many other things that you guys can do. So realize your worth. The board you told me was only in the US. You should find, they have a Canada equivalent because every time I went on there, it said for US and Canada. So they have a Canadian equivalent. You just got to look. All right. Anybody else? Anybody else got any questions before I log off? Any other questions? All right. No, of course, another little shameless plug. If you are to the point now to where you're just like, I don't know what to do for this exam. I don't know where to start. I'm tired of failing. If you need guidance, if you need mentorship, you can check my link out in my bio. And my link in my bio, I have one-on-one private tutoring where we get on one call, or we can do a package deal, part of my NCLEX coaching and mentoring. Whatever that you need, we can make, we can tailor to your needs. Of course, check out my girl Stacy. Right, I dropped her video in my bio, as well as I put the video up on my YouTube channel. Hey, she took her exam 12 times. 12, passed on the 12th time, y'all. Found me and asked me to help her. I helped her. I guided her. She rocked it. And now she can sit. Now she's an RN, and she was an LPN for about 10 years, right? So just know that it can be done. But remember, in order to conquer our NCLEX, it begins with you. It begins with you, and you have to put in that effort, okay? Yeah, I will like to start preparing and start classes before completing the NCLEX registration. Okay, you can do that. You most definitely can do that. There's options for you to do that, You got to find out which one you want. But of course, if you're looking for anything of mine, those are all linked up in my bio. I'm starting my 5th semester on Tuesday. Would the course be helpful? I would think so. The course is going to be helpful for you, Ashley, regardless, is because you're going to have a course that's already going to be setting you up for when it's time for you to go sit for your exam. If you want me to be completely honest. So, and you've already had you've already downloaded the free one, or the free stuff, and you had the ebook. So you already know like what the caliber of what the lectures look like. You know what I mean? So I think that for you, I think that you would like it. You would like it very much. And then of course, I would expect for you to give me feedback, because I only want to make things better, because it's not just my review, it's y'all's, because y'all help make it better with your feedback. Okay. So, but, yep. Last little shameless plug. Of course, if you need help with anything, check out my links in my bio if you're looking for one-on-one coaching. Also, I have a course, an on-demand, self-paced course that's up there. You can use that as well. Check out my YouTube channel. Also follow me on Instagram. I'm over there too, hanging out. Yeah. And of course, if you have any questions about anything, you guys can shoot me a DM. I don't ever have a problem answering my DMs. I answer them all the time. I get tons of them. So if I don't get to you, be patient. Or if I don't get to you, maybe send it again and see if you go up to the top of the list. Hey, this is the first Wednesday of 2024. All right. You got to put the work in. No one's going to give you a license. No one is going to, give you a job. No one's going to give you the experience. You got to work. You got to work out here. All right. So I appreciate everybody. I'm glad everybody had a good, safe weekend. You guys continue to be safe. I will see you guys on Friday. And of course, be on the lookout for all those wonderful things that I have coming out, because January is going to be a very fulfilling month. Not just for me, but most definitely for you guys. So we're going to start 2024 off right. And I will see you guys on Friday. You're welcome, Ashley.